Welcome, Rachel Frontain. How are you today?
Good. So good.
Are you excited?
Yeah.
I'm excited. I'm excited because you're going to have to introduce yourself to not only the listeners, but myself as well, because we never actually officially met, but obviously seen each other in the gym. Mutual friends, Matthew Flynn.
Yep.
And I remember him and I had gone out for full one night, and he was explaining what was going on at your chiropractic clinic and stuff. And then I had spoke with your boyfriend, and he was like, yeah, you're going to want to talk to Rachel. She's the nerd and all this stuff and everything. I was like, okay. Said, I'm game. So I reached out to you, and I'm glad you're here. And
I mean, it happened like that.
Right?
Look at
and
it split.
Thankfully, like, we're not being, drowned out by smoke right now. At least it's cleared up a bit, because it was pretty bad yesterday.
It's horrible. I've had a couple patients call in and be like, I'm going crazy. What's going on? My eyes are crazy. And I'm like, close your windows, take your glutathione,
Yeah.
pop those antioxidants, and just like wait it out, because it'll chill.
Did you find yourself pretty fatigued?
I didn't, but I'm usually on a pretty heavy dose of liver sport anyways.
Yeah.
So, and I just kind of avoided it, and we don't let the dogs out in it that much, and we play those games inside.
Yeah, there you go. Yeah, I took them for a walk. Yeah, yesterday was the worst.
Yeah, I think so.
Yeah, I took them for a walk yesterday. I'm like, we are not running. We're just going for a quick walk, because they'll annoy the hell out of me otherwise. And so just a quick light walk. And yeah, they said, I think after today it should be.
Yeah, after Wednesday. So hopefully today is kind of the day. It doesn't smell today, which is nice.
Thankfully.
Yes.
Yeah. So let's get into it then. How about you introduce yourself? You can start wherever you like to start.
Okay. I'm a chiropractor by training, but I am not a general chiropractor by any means. When I was in the States, you can specialize like you can in like medicine up here. So you could be like an internal medicine chiropractor. You could be an acupuncturist. You could specialize in pediatrics. You can also specialize in neurology. So I specialized in neurology when I was down there. The field is technically called chiropractic neurology or functional neurology. And with that education, you learn about the major systems, the major sensory systems your brain is using to figure out about where you are in space all the time. So that actually contributes the most to postural stability. But in chiropractic school, they're like, oh, like figure out where the dysfunction is and like pound down the high spot. And you're like, okay, but why is it high, right? Why is there muscle tension in the body? Why is that shoulder higher than the other? So the three major systems that I focus on in my practice are the visual system and all of the different eye reflexes, the vestibular system, which is part of your inner ear that's telling you about where your head is compared to your body or where you are compared to your environment. And without that, we would literally be zombies, like without any sense of direction. So it's critical that it's working optimally. And then proprioception, so the feedback you're getting from like your muscles and joints about where your body parts are in space. And then all of those systems come together largely at the level of the brainstem to communicate and like help you control your body, right? The brain is just like a big relay system. It's taking sensory information in, figuring out how to process it, and then what's the appropriate motor response. So when you have things like super tight, chronically tight muscles, it's an inappropriate motor response to sensory information coming in. What's messed up? The sensory system, the processing. It's usually not the muscle. I say muscles are dumb. They're told what to do by the brain. So why focus on the muscle when it's probably not the issue unless there was like a strain injury?
Okay. So what... Because obviously, like, and we're going to get into this, like, you're on the very technical aspect of things. Like, I've done quite a bit of research, like, via your Instagram and your website and stuff. And so it's Anew Chiropractic Clinic?
Anew Chiropractic, yeah.
Yeah, so that's the name, not a new clinic. It's Anew Chiropractic Clinic. Okay. And so we'll touch on more of that later. I'll put all where you can find in the captions and everything as well. But so what drove you to such... Because I myself am very passionate about getting, like, super, super in-depth, but it's very difficult to find like-minded people or people that you can have that conversation with without it going over their heads. And that's nothing against anybody. It's just not what they're into. So what drove you to that very technical aspect?
Yeah, that's a good question. So like from a super young age, I was going to be an orthodontist. I wanted to be my own boss. I wanted to make a fuck ton of money.
Of course.
And so and I had braces, which like completely changed my life. My smile, my confidence, like, so that was like grade 3 or grade 4. And until I was like 21, I was going to be like super specialized in this like facet of dentistry. Trying to get into dental school is like a whole other hill to climb, and I ended up like missing some cutoff by like 0.1%. And I was like, okay, like maybe this is not for me. Maybe that's a sign. And so I started kind of looking elsewhere. And for a while, I was like living out in Vernon, BC, and thought I was going to be like small town massage therapist. And my parents were like, no, Rachel, sure, you're going to be bigger than that. Nothing against massage therapists, but like my dreams had been up here, and they're like, no, keep looking.
Yeah.
So I was dating a guy out there. We went back to his hometown in like Stonewall, Manitoba. And I ended up going off of this like jump that was like, okay, well, first of all, their hill there is like the garbage dump. So it was tiny, right? So, and they literally had 2 trucks that had like a pulley system hooked up between them. So you literally grab on and the motor of the truck would just like fling you up the hill.
Sorry, did I miss it? This is like what, skiing or something? Or
skiing.
Okay, skiing. Yeah.
We went snowboarding in his hometown. So we're like used to the mountains. We're snowboarding on a hill outside of Stonewall, Manitoba, which is actually a garbage dump. And there's nothing to do there. You can go down the hill in like 2 seconds, or you could try one of these 3 features that they had built, which were massive, like park features, like tubes that went like dun, 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 and like 30 feet long. Or they had this massive jump, and it's all stuff like I never went in the park. I was like an all mountain rider. Yeah. So I didn't have many options. So I ended up flinging myself off the end of one of these pipes.
So what she's referring to, for those that don't know, when we say features, we're talking like grinding rails or boxes and stuff like that.
Grinding rails, boxes, tubes, like down, flat down kind of rails that you see.
Metal and painful things if you crash.
Pain. So I thankfully didn't land on the metal, but I didn't know how to get off of it at the end. So I ended up getting like flung down the down slope, which had to be huge because it was a big feature, to the bottom, which was ice. And I landed on my tailbone and just went like splat. And it was like excruciating pain I had never experienced in my entire life. And like I was down and out for the entire trip, basically laid out on the couch. And then we had to drive back to Vernon like 22 hours sitting on my butt. I had to get like a build. Everybody's like, you should get a pregnancy donut. I'm like 21. I don't know what that is. So I like rolled up towels and I'm like trying to drive. It was awful.
You need that hemorrhoid cushion or whatever.
Exactly. So went to my gym to cancel my membership, and people are there telling me like, you're fucked. You're never going to have kids. Your tailbone's probably pointing in towards your body and you're going to like kill your child if you have birth. And I was like, oh my God, like I was terrified. Okay. So I'm on the verge of tears thinking my life is like changed forever. And then somebody was like, go see this chiropractor. She knows the female body so well. So I literally just drove there and like showed up at her door bawling and was like, can you help me? Turns into like her helping me get back into snowboarding like a month later, after hooking me up with somebody who did acupuncture, who did cold laser. She managed my soft tissue. She managed to figure out like it's probably not a tailbone fracture, even like it's not even broken. So like that was huge. And that's when I was like, this is how I want to get into helping people. I knew I wanted to be hands-on. I knew I wanted to use multiple modalities, and chiropractic seemed to be the way to do it. So she introduced me to her mentor, who was studying functional neurology at the time. And then I also called my chiropractor from childhood back in Saskatchewan, which is like where I'm from. And he was studying functional neurology too. So 2 completely separate people that didn't even know each other are both telling me about how functional neurology is the future of medicine. If you go into chiropractic, you have to study this. Like they couldn't even like really describe to me what it was, but it was just like, it like lit this spark in me. And from then on, I was like determined to be a functional neurologist. Yeah. I had no idea what it was, which is kind of bonkers. But you go to chiropractic school. So I ended up choosing to go to chiropractic school in Portland, Oregon, University of Western States. It was close. It was really, really great school. Tons of Canadians were going there too. really great area in the world. And like loved it. And when I was there, sometimes it would come up like, hey, is anybody interested in getting into a niche? And it was like, I'm going to be a functional neurologist. And eventually I got pointed to Dr. Glenn Zielinski's practice, he's in Lake Oswego, which is like a southern suburb, I guess, of Portland. And I went and shadowed there, and I was like, oh my God, this answers every single question. He was helping people who had like not just general chiropractic problems. Like he was helping like everybody with this approach, basically. And I like when I become passionate about something, like whether it's functional neurology, whether it's the dog training that we were just talking about before this, like I just like jump in whole heart and like follow my gut too. Like it just felt right.
Mm-hmm.
And so, yeah, I've always been like a very interested in technique, interested in doing things correctly. At one point I was like super into the Strong First kettlebell program, and like that's all about technique and all about like utilizing kettlebells like efficiently and building strength and building strength efficiently, using your body efficiently and stacking your joints, like all of this stuff that just technically makes sense to me. So when I found a niche of chiropractic that was making sense and isn't just like, oh, well, it's high, like pound it down, like that's not enough for me.
Mm-hmm. Yeah.
So this answered those questions, and like I will forever be learning in this realm, because they're always learning new things about the brain. Like you cannot stay on top of the research enough to really like know it all ever.
Yeah, girl, you are preaching to the goddamn choir. So, because this is where I'm at in my realm, because I'm a lot with like gut microbiome and the immune system, and like I'm really getting in much deeper into the complexity of the immune system right now.
Oh my God, we are going to be here for hours.
Well, because like you look at the population, I created a post the other day and I said, it's like, do you actually have leaky gut? Because leaky gut's such a hot topic, right? And majority of the people out there don't, like, we all have leaky gut to some extent. Like, I'm not saying you don't have leaky gut, but you're biasing all of the issue towards something that is not really going to work out with the way you are addressing it under the current context. So this is when you look at immune pathways and like, okay, yes, you could say the leaky gut is stimulating this immune pathway, but you have to look at managing that immune pathway in order to subside the symptoms of what you believe is leaky gut, because it's such a broad diagnosis. Like the leaky gut, IBS, IBD, it's such a broad diagnosis. And like I catch a lot of hate for it because I say it's a diagnosis for people that don't truly know what they're doing, right? And it's because, like, for example, glutamine. You say, okay, glutamine, you got leaky gut, glutamine is going to patch up the gut lining. There is quite a handful of people who take glutamine because they've been told they have leaky gut and they feel worse because of the immune cells it's fueling, because it's an overactive response of an immunity, not actual leaky gut per se. And so it's,
you have parasites in there,
carrying viral loads and everything and all this kind of stuff. And I just saw a video yesterday of my mentor's client, a 3-foot parasite coming out of the colonic. It was
in the colonic, so it just like floated into the,
you saw the tube and everything. It was intense. I sent it to my one client. I was like, I should have asked first. She never replied to it. I was like, yeah, I should have asked first. But to me, like, because I can understand where you're coming from, because you see that, yes, it's disgusting, but at the same time, you're just amped up.
Yeah.
Because like then you're learning like about parasitic protocols and all this kind of stuff.
And where are they hiding? What organs are they hiding in? They're not in the gut often.
It's usually the biliary ducts. And the biliary ducts and the bile and everything. And that's why people have all these bile issues and the recycling inflammagens and toxins and everything, because these parasites. But one thing a lot of people don't know, do you know the percentage that parasites actually cause cancer?
I'm going to guess it's like 60%.
Not that high, but it's still pretty high. I think it's like over 20, but don't quote me. Like it might be higher.
It's crazy.
Like, and because they carry viral loads and people are unaware of that. And you get something like Giardia and they're like, oh, it's Giardia's, man, it's just minor. Like if you Google it, it's like, you don't got a lot to worry about. It's like, it can still significantly disrupt digestive function. Then next thing you got H. pylori. And then next thing you know, your mucosal lining is compromised. And then, then you talk about getting into the brain. Neurotoxicity and affecting all those motor patterns. Like you mentioned the word posture. As you can see, you got me excited. You mentioned the word posture. A lot of people don't realize how much poor posture can also be linked to bacteria because of the neurotoxicity, the lack of confidence with the health complications, and you just go inward.
You do, and then you're not breathing properly. And then you get poor vagal tone, and vagal tone is all about a healthy gut. Like oftentimes I get patients who have seen functional medicine practitioners or worked with naturopaths for years and have spent like hundreds of thousands of dollars on supplements trying to fix their leaky gut, and they have no vagal tone because they were in a car accident 17 years ago. And like now all of a sudden they're getting like, well, not all of a sudden, they've had brain fog for the longest time, or they've had issues swallowing those supplements, or they, they're constantly breathing here. My neck is just so tight, but it's like all the accessory muscles that you shouldn't be using for breathing. And so we lose like function of the diaphragm. We lose vagal tone, motor tone. Like your vagus nerve is supposed to stimulate your gut to actually move stool through the large intestine. You start losing that migration pattern, and then the stool sits there and it ferments, and then the ileocecal valve opens up, and that's oftentimes due to like a right vagal failure. And all of a sudden you are ending up with like small intestinal bacterial overgrowth, but like they keep trying to like kill the small bacteria or the small intestinal bacteria, which shouldn't be there. You should only have bacteria in your large intestine. But like the ileocecal valve is still open. So it just keeps like coming back up, and then they just keep trying to like push the stool forward. And it's just this like back and forth. It's like, okay, let's actually look at the brainstem function. Let's stimulate the brainstem to actually have appropriate motor output to the gut, close that ileocecal valve, get motility through this gut, and then all of a sudden these patients are like responsive to the protocols, because it's not that the protocols are failing them, but their neurology is not intact or functional or efficient enough. So the whole concept behind functional neurology is like, do a thorough neurological exam, figure out what's not functioning optimally. Like the neurologists are going to find the hard lesions. They're going to find the brain tumors. They're going to find like the space occupying stuff, the scary stuff, or like, where there's been an accident and you've actually like severed a nerve, right? But in terms of function, they're not going to tell you, okay, your neurology pathway or your vagus nerve should be sending like 100% information to your gut, and it's only sending 70% information to your gut. They're not going to be able to tell you that. Whereas if I tell you to like stick your tongue out and it goes to the right, that means you don't have as much muscle tone on the right to keep it pushing forward. So you have decreased function in your lower brainstem near where the vagus nerve is. If I try to stimulate your gag reflex and you don't have a gag reflex, you don't have very good vagal function.
Another one too that I say, if you ever feel like pills are stuck in your throat, they're not actually stuck. Like some can, because you ever burp and a big puff of powder comes out. But in most cases, if you feel the need to constantly swallow, it's lack of peristalsis, so poor vagal tone. And so that like people think they have these pills stuck, so they drink, and nothing happens. It's because the peristalsis is weak.
Which is a functional problem.
Yeah.
So then you figure out how to stimulate that area to improve function. So that's the whole concept of neuroplasticity. Like stimulate the pathway, and you will literally grow new neurons to help support that function. So what I do with my patients is we come up with a rehab protocol using eye movements, tongue movements, head movements, body movements, and stimulate the areas of their brainstem or brain that are under firing, whether it's from a concussion, whether it's due to long-standing chronic dizziness secondary to BPPV, or maybe they like been the crystal floating in the ear. People usually know that. Secondary to actual damage from a stroke, like figuring out what's not functioning and how to stimulate that area to improve function and help that person regain quality of life, independence, the ability to have confidence moving out in their environment, because like the world is a really complex place. And if you can't use your eye movements to take it in efficiently enough, then you're going to feel unsafe, which is going to put you into a state of fight or flight and push you out of parasympathetic state of rest and digest too. So there's a ton of my patients come in with digestive issues because they've been stuck in fight or flight for so long.
Did you see my post about the chill pill?
Yeah.
Yeah, that's what I mean. everybody's stuck in fight or flight. And so,
Well, especially after the last couple of years.
fair enough. So, but yeah, I love that, because a lot of health complications, like if it's acute stress, a lot of the times addressing like what you do and stuff will really help. It's that chronic stress. You'll make good headway, I find, with certain modalities, but then you have to go in like, okay, what kind of damage was done to the gut? What kind of damage was done to the brain? You know, where's, like, are you familiar with like high dopamine and low dopamine symptoms? Dopamine, sorry.
Yeah.
Yeah. So like you got to differentiate, because we use, like, a lot of people think brain fog is low dopamine. Well, it could be high or low, right? And then but why would you be in high dopamine under a chronically stressed state?
Well, you're stuck in fight or flight. Your midbrain drives dopamine to
right? But then you'd think, because you'd be converting everything to adrenaline. So that was me. So if you look at my actual genetics, like I shuttled all my dopamine to adrenaline. So once I started like actually manipulating my B vitamins appropriately, like higher doses of niacinamide, for example, and methyl tetrahydrofolate, I was able to actually like keep more dopamine in the brain. But I also, from a genetic standpoint, have very low estrogen. And so that's where a lot of that dopamine comes out of the brain. So you find individuals who tend to get like chronically stressed, theoretically hormone production should be decreased. And like obviously like birth control in females is going to play a huge role with desensitized hormones. But it's interesting what you run into from a neurological perspective of who is actually high and low dopamine. And then all of that stuff as well is affected, the stuff that you work with, like the sensory and everything. And so do you see something like that a lot in practice, or?
You know, so I use functional genomics sometimes. I use the DNA company, and I love their reports that they give. They basically, who did you use for your?
So I just use Strategy.
Okay. So the DNA company basically takes all of your DNA and then gives you various reports, whether it's like mood reports, detox reports, immune reports, like all these different reports. So you learn about basically where your genetic holes are, and then you can learn how to plug those holes. They talk about like, you know, people are set up for Alzheimer's. So we're so hyper-focused on figuring out why these people got Alzheimer's. And like 80% of the population that has the genes for Alzheimer's gets it. What about the 20% that didn't? We're interested in figuring out how to prevent the Alzheimer's. So do genetic testing, figure out what your genetic holes are. Like, are you not good at detoxing? Are you more prone to having cardiac inflammation? Are you more prone to having hypertension, high blood pressure, things that contribute to Alzheimer's? And so I use that with my patients a lot, and they do have one for mood and neurotransmitters, like neurotransmitter production. So I don't use it as much as I should. I find, like, again, I come back to kind of functionality, and don't get me wrong, neurotransmitters is like a deep dive that I would love to do at some point in my career for sure. But oftentimes what I find is there's actually like an asymmetry in function. So like you have two halves of your brain, you have two halves of your brain stem. And oftentimes there's like dysfunction happening in like one half of the midbrain compared to the other. So maybe this person tends to have more output on in one half of their midbrain, which drives like one half of their cortex, and the other side kind of shuts down. But they get stuck in this like hyper-driven, like dopaminergic pathway. Well, that other half shutting down means that, okay, this is going to be kind of a deep dive, but dopamine drives your basal ganglia, which is subcortical area of your brain that basically drives the gas pedal and the brake pedal for everything: thoughts, emotions, movements. Okay, so somebody has a Parkinson's disease. They have proteins, alpha-synuclein proteins building up in their substantia nigra in their midbrain, so they're not producing enough dopamine, right? So dopamine drives both the gas pedal and the brake pedal. So you see disruptions in both of those.
Sorry to cut you off. Where's your stance with GABA with that though?
What do you mean?
So, here's how I explain the neurotransmitters, like the main four. So dopamine is your engine, your horsepower.
Okay.
Then we have acetylcholine is your accelerator. So this is why people who take like a lot of choline donors, because alpha GPC is claimed to increase learning and focus, because it is. That's what that neurotransmitter is for. But then once you're always on the accelerator, so you're depleting your dopamine. And then GABA, I explain, is your brake. So that's what's going to slow you down. And then serotonin is your alternator. And then in practice, what I've seen is so if you look, Dopamine and serotonin work inverse of each other. This is why obviously it's higher in your sleep. Yes, metabolic recovery, but it's also, as mentioned, alternator. But if you are trying to, so this is why when we look at the realm of depression, we use SSRIs. And so like I explain to people like what actually happens, increased monoamine oxidase, decreased receptors. So it's actually a cash cow of the medical industry. But anyways,
Yes.
but you get these people and they take these SSRIs and they just become numb. Like they don't get any happier, but they're also still not really depressed. That's because, and research is showing like there's a ton of validity to it now, that it's actually dopamine that's responsible for depression, the lack thereof.
Mm-hmm.
And so when you look at how I look at it is I look at, dopamine is let's go. It's I've always said it's your get shit done, neurotransmitter, and then GABA is your break. Mm-hmm. And so that's wherein with like your findings and stuff, where does dopamine apply as the break?
Oh, so like you have different pathways within your basal ganglia that are driving movement and also inhibiting movement.
Okay.
They're driving thoughts, but also inhibiting thoughts. So like if you have, say, Tourette's, you have more drive through like the pathways of the basal ganglia that say go and not enough brake pedal.
Okay.
So I'm specifically just talking about like basal ganglionic stuff, because like in a patient who has Parkinson's, for example, they're not driving enough dopamine into that system. They're going to have a movement disorder, usually that pill rolling tremor, but then they're also really slow. Mm-hmm. And then the midbrain is also responsible for things like upward eye movements, vertical eye movements specifically, and they start to not be able to do those, so they end up with this camptocormic or like hunched over posture. So their midbrain is literally like they're losing function of their midbrain because it's getting crowded out by these proteins. So they're like losing dopamine, and they often respond to actually getting dopamine as like carbidopa, like L-dopa drugs, specifically there. But they do end up with depression or anxiety, because you're also not driving enough, like
hallucinations. Because you're pushing it. There's that lack of clearance.
Yeah.
Because like when you talk about the genomic expression, in that instance, we're going to see high correlation with I'll just say disrupted catechol-methyltransferase gene. Mm-hmm. So then it's staying in the brain. Or if you look at like the adrenal function, because we don't have dopamine to respond to everything. So now we're using excessive levels of cortisol.
Yeah.
And like, I don't know about what you've seen in practice, but adrenal fatigue is a lot rarer than people think. It's more about cortisol resistance, or the conversion to adrenaline is what is more the complication. But I'm sure in these Parkinson's patients that they actually probably reach a state of adrenal fatigue over time because of just solely relying on those adrenals.
They usually do need like a multifaceted team to take care of them. Like they get, like I've seen reversal of Parkinsonian symptoms depending on how far along they are.
Do you know Andrew Rostenberg, Dr. Andrew Rostenberg?
No.
That's what he works a lot. He reverses it all the time.
Cool.
Yeah. You should check him out. I'll send you a link.
Nutritionist, naturopath.
He's got it.
Is he?
Yeah, he's really big into methylation.
Say his last name?
Andrew Rostenberg.
Rostenberg.
Yeah, he's really big into methylation. So I learned a lot of methylation stuff from him.
Nice.
And so like for those that don't know, like when she's talking about like genomics and everything, what's that saying? Genetics load the gun, but lifestyle pulls the trigger. So when you see like a gene or a genetic SNP, single nucleotide polymorphism, saying that you're potentially going to get Alzheimer's, it's your methylation that is what's going to dictate whether or not. And so for people that don't know, when you have people like to argue now and say they're not mutations, they're actually beneficial. Maybe when we were in prehistoric times. Right now, like you not being able to sleep, there's no benefit to that.
You not being able to detox when you're like, your coffee could be full of toxins.
Yeah, there's no benefit.
This is the best fucking coffee though.
So like, because back in tribes when we got, saber-toothed tigers lurking around, of course, the guy that's going to protect the tribe is the one that can't sleep properly. It's like genetically gifted people, right? They're actually not genetically gifted. That's a mutation, because the easier you build muscle, the quicker you died back then. But hey, it's 2023. We got unlimited resources now, so it's a gift, right? But this methylation, how I explain it, you might have to hit her a few times, starting to snore. Okay. How I explain it is, let's say you have a ladder and at the top of that ladder is optimal health and wellness. Mm-hmm. If you have a genetic SNP, you have a broken step on that ladder. Yeah. So if you're poorly methylating, every time you try to climb that ladder, you step on that broken step and fall back down. Mm-hmm. So if you're properly methylating, though, you're going to take that extra step over that broken step and keep climbing on your way up.
Nice.
And so that's kind of like how I explain that to people.
Cool.
And so like in your practice, is that something you've noticed has changed? Because you talk about like detoxing, for example. Are you able to manipulate that via the modalities you use? Or is that still something, because you brought up the word like glutathione, for example?
Yeah.
Do you use that kind of approach, modality? Or is there something that you can do with the brain to help stimulate better detox pathways?
Not necessarily. And like always open to learning, but I'm more focusing on like improving the function of the nervous system, because the nervous system controls every other organ function. Doesn't necessarily mean that the message is going to get through. Like oftentimes I say I'll do what I can with the neuro rehab, and then whatever pieces are remaining, like whatever issues are remaining, we're going to plug it in with either like trying different supplements or getting you to see a practitioner who treats chronic illness. For example, I see lots and lots of exacerbated chronic illness that was probably latent before the person got COVID or COVID-related items.
Yep. TH1.
And like it was all an insult to the immune system, and COVID itself was very inflammatory and created a lot of fibrosis in a lot of systems and decreased function of lungs, decreased the gut, decreased
high levels of estrogen,
high propensity for wreaking havoc in the nervous system, the liver, the reproductive organs, and the gut, and like also obviously like cardiac issues as well. But what an inflammatory environment stimulates is dormant viruses that were living within the nervous system, or dormant, well, they weren't dormant, but like parasites. They become a little bit more present or active, and people just don't know what's going on. They're like, oh, I had COVID back in March, but like come August, I felt like absolute flaming hot garbage.
It goes back to that Th2 pathway. Like Th1 is going to be the responsible for viruses, where Th2 is going to be responsible for like the toxins and the acute bacterial response and the allergy response and everything.
Creating inflammation to help rid.
So, but most people, so it look at it as, because you got your Th0 and then you have your T regulatory, Th17, Th1, Th2. Think of it, you only have enough substrate for one of those, in very simplistic terms. So think of it as on a lever. So as soon as you start promoting, like parasites, for example, will push Th2, estrogen will push Th2. So all the COVID accessories involved are all going like this. And it's like, I don't know if you saw, I had a good chuckle. I'm not pro-vax, I'm not anti-vax, do whatever the hell you want, okay? But I did see some. Yes, exactly. So I saw something on the internet, and it was like a list of supplements that it's like, you don't need the vaccine, just take these, right? There was glutathione, okay, so we do have an immune modulator in there, but everything else was to push Th2, which is not responsible for viruses, and there was activated charcoal in there. And I was just like, this is the education that's out there though, right? And it's so difficult to find people like yourself, not only like with the knowledge, but like the actual, like I'm going to say obsession for it and the passion for it to be able to help people. Like I was, like I said, I was on your Instagram and seeing these people struggling with those issues, and then you do your, you know, really cool reel idea and flash, and it's just like to see that tremendous change in people. For someone like me, is such an exhilarating feeling, because this is what people like you and I fight for, because everybody else in the world says, no, you can't do that. That's not achievable. Parkinson's isn't reversible. Alzheimer's isn't preventable, right?
Yeah.
And then how much does that frustrate you?
I like, this is gonna, I don't know why I feel emotional about this. When I saw that Chris Hemsworth, super babe.
Yeah. I'm not gonna argue with you on that one.
Man, every woman knows he's a fucking babe. He like did genetic testing and found out that he had the genetic makeup to get Alzheimer's, and then they did this like, his wife like got dressed up like she was 70 years old, and they had this like date as it, because he's probably not going to see her and remember her when she's 70. I was like, who the fuck not jumping on this opportunity to educate this man and get him optimized to not get Alzheimer's so we can all enjoy 70-year-old Chris Hemsworth.
Let's be real though, okay? Babes are not always the brightest, okay?
No, but you're surrounded by like amazing people who are keeping you healthy. Like you should have, I would think, access to someone.
It's just so overpowering though. Like it's just so like, oh my God, I'm gonna get Alzheimer's, and then kind of like ignore what everybody else has to say.
Maybe.
Yeah.
But like, I don't know, the DNA company has worked with, like they literally go on movie sets and optimize actors, optimize their performances. Like, what? Why are you succumbing to this?
It's so hard to watch something like that. Eh?
I was blown away. I like flicked through it.
Like his facial expression when the guy told him, and the guy was so like enthusiastic about it too. He's just got these wide eyes. Like, yeah, you're carrying the genes for Alzheimer's or whatever. And it's frustrating because a lot of us look up to celebrities as authority figures or like athletes. You think athletes are the healthiest people with the greatest trainers and the greatest chiropractors. This is what I always say. LeBron James is so good because he's LeBron James. Yeah. Genetics. He was meant to be like that. Thank his parents. Like, I'm not negating any hard work ever. I would never do that. It works.
Michael Jordan ate KD before every game.
Right? Like,
come on.
LeBron's always showing Taco Tuesday. Like, it's like, you know, they're just genetically gifted, right? Yes, they still work their butt off. Like I said, like everybody, please understand, I'm not taking away hard work, but we can't look up to these people and be like, okay, well, if Chris Hemsworth is going to get Alzheimer's, what chance do I have?
Right.
You know what I mean?
And also, like, he takes exceptional care of himself. He probably won't. You know, like he's probably going to be in the 20% of people who don't get Alzheimer's because he's taking care of himself. I would think. Like, we don't know. But like when I did my functional genomics, I found out that I don't methylate well. Because of my, like, we could get into like energetic stuff, but because of my profession, like I feel, and because I take on those patients, like what you saw, who are in these extremely challenging situations, who have been rejected by healthcare and told that there's nothing you could do. Like Andrea was told, like, you're going to get better, but it's going to be like climbing CN Tower. Like, what kind of hope does that give people?
Oh, the lady in the red shirt?
Yes.
Yeah. Mm-hmm.
Yeah. So she, amongst like other patients, come into my clinic after being told like, there's no hope. So I take those patients in and do what I can for their nervous systems. And oftentimes it's something that gives them an aspect of their life back.
Mm-hmm.
And like, that's a lot for me to take on. So then I need to be like making sure that I'm taking care of myself really efficiently and effectively, because I could get stuck as an empath in their emotions. We have to be supporting our livers because we're taking on their stress. We need to be getting rid of that. We're like, for me, when I am overly stressed, like I create too much estrogen and I'm already genetically prone to be estrogen dominant. I'm set up for methylation defects. Like, I'm very poor at methylating. I am set up for cardiac inflammation, hypertension, hypercholesterolemia, like all of those things. So I have felt the best now, like at this stage in my life, and been in like the best shape because I have figured out all of these holes and how to plug them. And like, I'm setting myself up for not having a heart attack or stroke.
What do you take for methylation?
Honestly, the DNA company makes they've started making supplements.
What are they called?
What are they called?
Are you familiar with Seeking Health?
No.
So that's Ben Lynch. So Ben Lynch is pretty much like the pioneer of the whole genomic thing.
Yeah.
That's his company, Seeking Health. That's what I was wondering.
Oh, no. Like the DNA company started to make supplements that were like geared towards
whatever your test says.
So yeah,
okay.
I'm taking, I think it's called like methylation optimizer from them. I take mitochondrial optimizer. I take sometimes their detox optimizer, but I'm usually on some plethora of NAC, glutathione, chlorella.
Your injectable glutathione?
No.
I get it from the States.
Yeah.
Yeah.
I had that conversation with Matt a while ago, and I've been currently not needing that. There was one stage when I was living in a very moldy house and like that was terrifying. Like I I thought I was going demented.
That's what I had. My mycotoxins were through the roof.
Yeah.
They were really bad.
So I have done injectables. I have done pushes and I have done IV drips before. I would love to kind of have more access to that again. I was working at a different clinic before I set up this clinic, and the naturopath there was super awesome. And I would get B shots, I would get vitamin D, like high doses.
On your Instagram too, I see lots of gadgets, and I love gadgets. So let's tap a little bit on that. I was watching one, the non-invasive vagus stimulator. How does that work?
Yeah, so GammaCore is basically like an electrical stimulus. I use electrical.
Sorry to cut you off. Let's actually just, if you can, in your own terms, the easiest way to explain the vagus nerve and the vagal tone. I know you did tap on it a little bit, but let's tap on that and then get into what this machine does, just so, because people understand.
Okay, yeah, fair. So first of all, your brain stem has cranial nerves in it. You have 12 of them, and the vagus nerve is the 10th cranial nerve. So they're named from top to bottom. Vagus nerve is close to the bottom, and it's called the wandering nerve because it wanders out from your brain stem, like down your neck, and it's involved in basically allowing your body to get into what's called like rest and digest mode, or also healing mode. Like, we can't heal if we're not able to be in a calm state. We can't heal if we're running from the saber-toothed tiger, right? So the vagus nerve wanders down and innervates your lungs, it innervates your heart, it innervates your gut, it sends like kidneys, liver, like we're getting all of these calming functions from the vagus nerve. And if it's not working, it's really hard for us to rest and digest our food properly. It also goes to the stomach and helps us produce stomach acid. So I'm sure we could have a big conversation about, are we putting proton pump inhibitors into into a stomach that's not producing enough acid? Probably.
Always ask people, what's the most common cause of low heartburn? And everybody will think it's high stomach acid, when it's the complete opposite.
There's no such thing as having too much stomach acid.
You can if you supplement. I learned that the hard way. But naturally,
can get you.
Yeah, naturally, no, I can't. I couldn't think of anything in today's society. I couldn't think of a thing that would cause you, unless there's some crazy genetic defect that's like shutting off prostaglandin 2 and COX2 and like whatnot. I cannot think of a way that you could have an overproduction of stomach acid naturally.
No, and you need a lot of stomach acid to break down that food and to actually absorb the nutrients from it.
Yep.
So the vagus nerve is important for all of those functions, basically. And when it's not working, then we can have issues that we've been talking about, whether it's digestive issues, whether it's motility issues, whether it's detoxification kind of issues. So like, I've had patients come in with like abdominal cramping, stomach cramping, constipation, or that switch between constipation, diarrhea, like too fast and then too slow. And a lot of it has to do with the fact that they don't have good output from their vagus nerve to their organs.
So what would you say is the biggest, that you've seen in practice, is the biggest cause of this vagus nerve issue?
Used to say concussions. They have shown in studies that like within 6 hours, you do get decreased output of the vagus nerve if there has been a concussion at the brainstem level. So, and like naturally, you're obviously going to flick into like fight or flight. But if you have torsion in the brainstem, so like a twisting mechanism, as opposed to just like a bump side to side or front to back, you get any kind of twisting, you put that brainstem at risk of shearing neurons that are running through the brainstem.
So like a car accident?
Yep.
Okay.
Car accident, got like getting hit on the head but getting flung forward, collisions in contact sports, a soccer ball that sends you backwards, like I like to think of the brain as being like a head of broccoli, and then the stalk is like the brainstem, and you whip that head of broccoli around, and you're not going to see much damage happen up here. You're going to start to see like leaking in those fibers that got twisted. So that's actually what happens in the nervous system. Those neurons aren't meant to take on that kind of twist, and they shear. And so you actually lose fibers in these pathways, and it's never going to be symmetrical loss, right?
Yeah.
So now all of a sudden you're getting like 30% input from one system, 60% from another. 90% from another that was largely preserved, but now we've got this sensory mismatch.
Okay.
So
I love that broccoli thing. That's really cool.
I gotta do a little like Instagram reel about it. But yeah, so concussions are a huge player in that, but like getting stuck in fight or flight, getting stuck in Th2 dominance can actually cause diminished output from the vagus nerve. And then like the vagus nerve also helps stimulate your spleen to become immune, to actually be able to fight things off, to create stomach acid, to again kill whatever bacteria is on your food, but then also break down your food. So I would say those kind of two things are the top things in my practice.
Okay.
That cause vagus nerve disruption. Migraines is another one, or like an overwhelmed brainstem, and like genetics plays a huge role into that, but sometimes it's coming from damage to those areas because of previous injuries as well that have triggered people to get migraines. Plus, like there's so many things that go into migraines: histamines, hormones. Their sensory inputs get like super overwhelming. So the wind can trigger a migraine.
Yeah.
Like I have a patient like that right now, but she's also somebody who's been chronically ill for a long time. Yeah. I've totally lost the question. So vagus nerve.
Yeah. So just
basically is the
illustrate the importance.
That helps you get into rest and digest mode.
Which nobody is in these days.
No, it takes a lot of work to stay there.
Yeah.
Tell you that much.
Yeah.
So with this gammaCore non-invasive vagus nerve stimulator.
So that's the company's gammaCore?
That's a company.
Okay, yeah.
Yeah. They have developed a product that stimulates the vagus nerve as it's exiting the brainstem. So you catch it on its way out in the upper part of the neck, and you can therefore stimulate 80% of the vagus nerve. Like, it's huge. And you're getting afferents as well as efferents going up to the brain with that stimulation. Whereas,
could you explain that, please?
Yep. So efferent information is information that's going to the brain, whereas afferent information is information that's going out to an organ. So I used to stimulate the vagus nerve by doing transcutaneous, we call it transcutaneous vagal nerve stimulation. So I would take a TENS machine and I would put it on some specific settings, and I would put it in here on the ears, and I would stimulate only sensory. Why am I screwing this up? Efferents going into the vagus nerve, basically. So like part of what the vagus nerve does, or like what inputs go into the vagus nerve, is like sensory information coming from like your ear, your inner ear.
Okay.
And you can stimulate like a small, like I think it's 5%. You can get like 5% of information that goes to the vagus nerve. So it's like super duper gentle stimulus, but it's also symmetrical, which is sometimes a problem for patients who have like one-sided dysfunction due to like an injury, or they have a migraine or something. So I love gammaCore for a couple of reasons. I love how much of the vagus nerve it stimulates. Instead of like 5% stimulation, we're getting 80% stimulation. So it's huge. You're also not just getting like sensory inputs that are coming from the ear. You're also going to get motor outputs going to the body.
Okay.
So it's also super easy to do. Like the unit that I have a couple of demo units, but one is going to be one that I allow for like renting out potentially to patients to see if they want to invest in their own, see if it works. Yeah. So the company does things a little bit weird. They're like, you're not going to buy the unit. You're actually going to rent stimulations. Days of stimulation. So they usually do it on like a 3 or 6 month program. For 3 months, it's $650. So it ends up being like $7 a day for this treatment. And it's like on label, been shown in the research to be very helpful at preventing and treating migraines and cluster headaches, which is amazing.
Yeah.
Considering options out there for people with migraines are not great.
Yeah.
You're like, learn what your triggers are, start working with like a naturopath or functional medicine doctor to diminish your triggers, whether that's like hormone imbalance or histamine levels, gut health, like all those things. But like if you end up with a migraine, they're like, okay, we're going to try a battery of like medications, triptans, and we're going to try to, give you escape meds if it's really, really bad. But otherwise, like you might be in a state of debilitation.
Yeah.
And like I have patients who can't work because of their migraines. They're just like constant. So if you can do something for $7 a day that's non-invasive and not a med and not something that's going to make you just feel numb to the world, that's huge.
Yeah.
But oftentimes people want to know if it's even going to work before they spend $650 for 3 months worth of treatment. So I have 2 units. I've been using it as like a vagus nerve stimulator for my patients who come in to see me. And I still have that second unit that I haven't loaded up with charges or with like uses yet. But basically you can use it like up to 30 times a day. The stimulations are 2 minutes long.
Wow.
They're
be good before eating then, eh?
Their typical protocol for like treating or preventing migraines is 2 stimulations twice, 2-minute stimulations twice a day. So 4 minutes of treatment in the morning, 4 minutes of treatment at night. If you feel like you're getting a migraine, like the first sign, like whether it's your aura, first sign of the migraine, try doing your stimulations, wait 20 minutes, do them again. If you feel like it's helping, you can wait 20 minutes and do it again, and you might be able to pull yourself out of that migraine state, which is super cool. Otherwise, they say like usually you should go for whatever things that you want to help you, whether it's your meds or the ice pack in the dark room.
Yeah.
So, but like I have tons of patients, like I said, who are stuck in this like fight or flight state due to, injuries that are causing them to stay there, different eye movements dysfunctioning that are causing them to stay there, dizziness, like everybody's kind of stuck in that state. And as I said before, like you can't heal from that state. So I usually use some sort of passive modality. Like I used to have, well, I still do have it. It's like an electrical stimulus that you can put on different parts of the face and tongue to basically passively stimulate the brainstem and encourage increased function temporarily before I go in and do any of my work. Because if patients are like, but what are we going to do? Like, it's not going to happen.
Right. Yep.
And so, I mean, part of that comes from like, personality and like recognizing when people need a good explanation of what we're going to do versus like, okay, I'm here and I'm going with the flow. Kind of takes reading the room.
Yeah. Do you get a lot of pushback from patients or, yeah?
No, I've put it out there that I would like a certain open-minded, excited, skeptical, but excited patient to come into my practice. And that's largely what I've gotten since going out on my own, which is super great.
Nice. So so here's how I explain this. When people think of chiropractor, they think of snap, crackle, pop. Yeah.
Rice Krispies.
And so
yeah,
I'll give you an example to help make sense of this question.
This is going to be a good question.
People call me personal trainer, right? Yeah. I'm not a personal trainer. Nothing against personal trainers.
Yeah.
But one, I have spent tens and thousands of more dollars than a personal trainer ever will, and thousands of hours more. I'm not going to get into that. Yep. But when somebody calls you a personal trainer, John with stage 4 prostate cancer is not going to work with you. No. So when you are... because is that what you'd be defined as if people were to look you up? Yeah. So how do you, because chiropractors do tend to get a bad name. Yeah. So how do you kind of navigate that realm? How do you kind of get your exposure out there and be like, hey, look, you are not dealing with your average chiropractor?
No, it's a really good question, and something I've had to kind of focus more on here in Canada, because in the States, like the guy that I worked for, Glenn Zielinski, made functional neurology, or like helped bring functional neurology to be within our scope of practice in Oregon. So there we were functional neurologists, and you can market yourself as a functional neurologist. And we were also like points of entry into the medical field. So we could like send patients for MRIs and CT scans. So like our scope was so open there. And now coming back to Canada, like functional neurology isn't a recognized specialty as a chiropractor here. There's nothing in Canada yet like that would allow me to have that designation and market myself that way. So I have to market myself as a chiropractor. And I get patients who like, you know, work in the same building as me, and they wander in and they're like, hey, like I have tailbone pain. Can I become a patient? Do you take insurance? And, you know, in the beginning, I usually like, unless they're walking into my clinic, I'm kind of quick to let them know that this is what my practice is, and that it does involve, you know, doing a bunch of in-depth tests to see how these sensory systems are working. And I'm focusing on the more like complex chronic conditions. And they're usually pretty quick to understand like, okay, no, my tailbone pain probably doesn't suit your practice. And I usually say like, there's amazing chiropractors in the area who can help you take care of that.
Yeah. Okay.
I usually say like when I was in the States, I studied neurology. And so I have this different niche within the chiropractic world where I'm like applying a different technique. And I talk about functional neurology as a technique that's applied because honestly, there were some bad chiropractors who went to like weekend boot camps and came out saying like, I can adjust the brain. And then they got it taken out of our scope. So I have to make sure that everything that I do in my practice, I can relate back to postural stability or balance or muscular control, the muscular system, you know, like I have to be careful that I kind of stay within that realm because I can't say as a chiropractor here that I treat Parkinson's, that I treat multiple sclerosis, that I treat anxiety and depression. But like, I tell you what, if you get the brain functioning better, you can improve. I'm not treating multiple sclerosis, although you should look at Epstein-Barr virus if you want to treat multiple sclerosis. But like, I can treat them.
Has that, eh?
Pardon me?
GI map can detect that from Diagnostic Solution. It has the Epstein.
Oh, cool.
GI can detect.
I usually use Armin Labs out of Germany, but basically there are motor, I call them concomitants, but like motor reflexes or motor disturbances that occur with all of these different disorders or symptoms that people are experiencing. So I focus on that in terms of like what I describe in my assessments and what I market to people, but it ends up having like a way more vast effect than just like improving somebody's movement.
Okay, so because like I know for me, I'll never get a PhD because then I'm put in this little box, and I wouldn't be able to practice like 75% of the things I do right now.
Yeah, I'm a little concerned about political things coming up, but go on.
Yeah, is there something? I don't really stay
Not for
up
you, but for
that. Yeah.
Yeah.
So why Canada then? Why here?
Yeah, no, that's a good question because I've gotten that a lot. Canada's home largely. So when I was down there on like a student visa. And then if I wanted to stay in the Oregon area, I was probably going to be staying with my like employer at the time, which was, you know, amazing. And I learned so much because we got the fucked up people that came from Johns Hopkins with no answers, the people who came from Mayo Clinic with no answers, the people who nobody else could treat. And we figured out like ways to treat them and get them back to what they wanted for a quality of life. And so I got thrown into like the deep end in that practice, and there's no way I would be able to do what I do today without that experience. Like absolutely not. But then when I had always had a dream about like bringing it back here, and we had a fair number of patients come from Canada because actually my like Glenn Zielinski and his wife are Canadian. They're like from Edmonton and small town Saskatchewan. We had a lot of people sent down to us by other practitioners who had like learned from Glenn in Canada, and everybody's like, well, why isn't it back here? Why isn't it in Canada? And like, nobody really thought it would float. And so I'm kind of like, especially in the prairies area, like very much what one of my colleagues calls the canary in the coal mine. Like, it's like, I'm just gonna I'll give you all the help you need in terms of like getting set up in Canada and like understanding the scope in Alberta and how to like what lines not to cross. But like I've got a really successful like orthopedic / some neuro practice up in Edmonton, and I'm just going to watch what you do down here in Calgary and see if you can actually like make a go of this. And I was like, cool, thanks.
No pressure.
Yeah, no pressure. Because like what I do, my treatment plans are very unique too. Like I don't typically see your like chiropractic patient who comes in twice a week. Certainly they're not coming in for life usually. I'm usually trying to make my treatment plans like treat as much as is appropriate, but also not trying to overtreat. And I want my patients to get back to life. That's that one half of my practice, but the larger half of my practice is by doing intensives with patients. So they come in for a week of treatment, sometimes 2, and we work on them like 4 to 5 times a day. And so I take like 2 months of treatment and put it into a week, and you see like exponential results with that. Well, who's going to pay for that? Are there people in Canada where healthcare should be free that are going to be interested in that kind of model? It turns out people really want to get better faster. So my entire first year of practice here in Calgary was only intensives.
Really?
Like every single week I had an intensive, and I had no patients wanting to do like the daily model, coming in like twice a day or twice a week for 6 months or whatever.
So these were the ones that came multiple times per day?
Yep.
Wow.
Yep. So like every week I basically honed in and focused all of my attention on one patient and making them better.
Really?
Yep.
How much did that affect outside of work?
Yeah, because I was the only person on, it took a lot for me to figure out how to have a healthy balance. Because like every patient comes in with a different problem and a different set of baggage. And so you're going to be super interested in figuring out as many pieces of their puzzle as possible while they're there, because next week it's going to be a new person. So coming home and like, or staying at the office and researching, looking at courses that are specific to, CMV that their doctor determined was a non-issue, but they have all these symptoms of CMV. Cytomegalovirus.
Oh, okay.
Epstein-Barr virus, like these viruses.
Do you actually see that quite a bit?
A fair amount.
Really?
A fair amount of people have, like 90% of the population they think has Epstein-Barr virus, which was, what everybody had as a kid is called as mono.
Yep.
But unfortunately, this virus tends to compromise our B cells in our immune system, and then it actually feeds it its own RNA, like our cells, its RNA or its like little chunk of DNA copy, and tells our immune cells, which should normally tell our immune system when it's in trouble and like send out little signals that say like, eat me, shoot me, I'm compromised, like kill me, kamikaze. It shuts down that mechanism. So then the virus can live latent within our B cells for years and like become kind of active when we undergo states of stress. So like, puberty is one time when it might come out, moving away from home, going to college, times of stress, divorce, death in the family, like all those kinds of things. So if you're somebody who like every time something big and stressful happens, you get sick, that's probably something that we need to be looking at. That's coming out a lot like lately with patients who are getting sick with this like, awful virus that like EBV tends to live, like it can live within your thyroid, so it can cause autoimmune conditions. We're actually starting to see that autoimmune conditions are like our immune system trying to attack viruses that are living within our organs, but they're so protected that we end up destroying our own tissue instead. So like how many people have Hashimoto's or an autoimmune condition of their gut or of their like thyroid or to their brain, and it's actually like our immune system trying to fight something off.
Between that and mycotoxins.
Yeah. Mycotoxins and then heavy metals. Heavy metals are where viruses like to feed on too. And like we take in tons of that stuff every day, whether it's what we're breathing in or what we're putting in our body or...
The mold conversation is so hard to have with people, especially people who are well off, because you'd be like, wow, have you ever tested your home for mold? And they're going to be like offended because they live in a nice home.
This is beautiful. It's only 5 years old.
Right. I'm like, well, you know, it could have rained when they were building it, and they're not going to tear it down and restart. Yeah. And so like people are so unaware of things like the Epstein-Barr virus and mycotoxins and all that kind of stuff. Yeah. It's obviously not new and upcoming to like people such as yourself, but to the general population, it seems to be, you know, people are starting to, when I say mycotoxins now, people are actually, like I've heard that before.
Yeah.
Where 5 years ago you said mycotoxins and like, what the hell is that?
Yeah. Oh, I've seen like in myself, we moved into a house when we first moved here, that was like going to get torn down. So they like delayed the tearing down so that we could move into it. And it turned out that the previous resident was like, oh, like it's getting torn down. So I'm just going to like not really care about overwatering plants on a genuinely hardwood floor. And there were like black and brown rings on the floor. And I, after being in there for a couple of months and like getting in the process of like starting up my own company, and as an independent contractor, I started to like be sitting on my couch and I would just feel dizzy. Like I was like, holy shit, like I am spinning, or like brain fog, like could not think, like it was like my brain wasn't firing properly. And I had just gotten my equipment in and was setting it up, and I was like, I'm running some tests on myself just to see how things are going. And like incredibly high reaction times for my quick eye movements, which is like the first sign usually like in a concussion, but oftentimes it's like one-sided. Can be present on both sides, like your eye movements in both directions are so quick eye movements to the left are controlled by the right brain. Quick eye movements to the right are controlled by the left brain. Oftentimes you'll see like an asymmetry if there's been like damage to one side of your brain from a concussion. But if everything is kind of like globally poor, then you've got to think about like a metabolic issue. And everything was globally poor. And I was like, holy crap, we have to get out of this house. Like it has to be that. So as soon as we got out of the house, I was like starting to do better. But I was able to, like I was working in a space with other providers like naturopaths who could give me high doses of glutathione and...
Can you buy those now?
I think I did GI detox at that point for a really short period of time.
Or biotowns. Yeah, I like carboxy and with their liposomal to break apart the biofilm to release the mycotoxins. That's what I use because I do work with mycotoxins a lot.
Yeah.
I had really heavy exposure too. Have you ever ran a mycotox profile? I have an account with them.
Didn't I didn't at that time, and like I was kind of working with another practitioner who like guided me through it. It'd be super cool to like run it again. I like it like 100% better, but it's always cool to run that stuff.
Yeah, I plan on doing, like I've definitely overcome the heavy symptoms of the mycotoxin exposure. Yeah. But yeah, probably because it's from Great Plains Laboratory. Yeah. And so I'll probably end up doing just out of curiosity to see where they're at. But I'd still do binders now.
Yeah.
Because I'm very Th2 dominant.
Yeah.
And so like I try to, I keep things very balanced as much as I possibly can, but stress wins half the time.
Yeah.
So of course, your neutrophils and adrenaline are causing your gut issues to exacerbate. Yeah. So I kind of like I was born with a lot of health issues. Like I was born not breathing. I had an extremely severe case of sleep apnea, blood pressure, cholesterol, all these issues. And so like my gut health
nerve wasn't working.
Yeah, right. So I had gut health issues from like birth. So you can imagine the density of the biofilms that were developed. So having that plus poor stress management, the high conversion to adrenaline, feeding pathogens within the gut. So I just always kind of have binders in, but I make sure to replenish calcium and minerals and borons. And I use a little bit of activated charcoal, a little bit of zeolite clay, and then carboxy powder, which is it's from the company Cellcore. And there's a whole science behind it, like the pH of it and the humic and fulvic acid and the carbon technology. Yeah. By far the best in conjunction, I like doing in conjunction with GI Detox. I love GI Detox as well. I use all of Biocid's products.
Yeah.
In conjunction, I find that along with breaking apart biofilms, even if somebody doesn't have an overgrowth, is very effective when addressing mycotoxins. But it's also because mycotoxins are going to push Th2 real hard. Well, what do you got to do to kill bacteria? You got to push Th2. And so it's like that freaking balancing act.
It's hard.
Right? And then people get stressed because you can only give them so much shiitake and turkey tail and everything for, you know, like ginseng, Panax ginseng, lemon balm, all that kind of stuff will work great as well.
Yeah.
But they get so stressed out. So now they're pumping out a ton of neutrophils, suppressing lymphocytes, and just creating a further Th2 response. And it's like, just take that chill pill, you know? Like, but I get it, right? I get it as somebody who's had SIBO, autoimmune bacteria, mycotoxins, etc.
Yeah.
I do understand.
Yeah.
I do understand.
I actually had a really bad concussion when I was really little, and that caused me to have what I think. Like, I think that there's potentially a genetic component in, like, you know, vaginal birth, got mom's bacteria. Mom didn't have probably the greatest bacteria. We don't know. But, like, I ended up with a lot of, like, digestive problems. And it's like, oh, well, it's because you're your grandmother's granddaughter. And this is all genetic. And, you know, everybody in the family is constipated. And I'm like, that's not a thing. Like, what's
Let me tell you something.
Let me tell you something. Constipation's not genetic.
That's hilarious.
So once I got into chiropractic school, I got exposed to paleo, which was kind of my like dive into changing diet and pulling things out that were maybe inflammatory, and like found out very quickly that I was actually like quite sensitive to corn. And like as soon as I would eat corn, I would get this big honking cystic zit on the side of my head. And I was like, ugh, like that's annoying. And then took out like gluten, dairy, corn, soy. Like I took out the main things, and kind of did hardcore paleo for a while. Then I ended up doing, like out of curiosity, work with this functional medicine doctor. So she was kind of like teaching at our practice and was like, oh, for students, I'll give like a discount. You guys can come into the student clinic and we'll run some labs. And I did run labs. Like I did a stool assessment. And I just remember like her scrolling through my results on the computer, and it had all of these like bacteria with this graph, and the spectrum was like green to red, right? And you want to be like in the greens.
Yeah. Was it a Genova test?
Yeah.
Yeah, okay. Yeah. I hate Genova tests. I heard them.
Everything was in the red.
Yeah.
Keep in mind, this is like 8 years ago probably. But everything was in the red. And she looked at me and she's like, how are you even a functioning human? Your gut microbiome is a mess. Like, we need to do all of this stuff. And I kind of like I had full-blown SIBO, and it explained a ton once I figured it out. And I ended up doing like completely by myself. So again, like find something you're passionate about and it kind of becomes an obsession.
Mm-hmm.
But I found this program online. It's called Gut Thrive in 5.
Yep, I've heard of that.
Yeah, by the Krista Orecchio. The Whole Journey is her company. And she basically, like, you had to do a questionnaire at the beginning, and it would plunk you into like one of 4 categories. And it was like probably parasites, viruses, SIBO, and H. pylori, basically. And you would buy all of her supplements, and you would go through the 10-week program, and it was like all guided, and like gave you modifications, gave you a cookbook, gave you like all of these different ways to address like whatever your problem was. And during like the hardest frickin' quarter of school, and during the summer, I decided to do this program, which was dumb, but at the same time probably really good, because then I didn't go, like I wasn't drinking, right? I wasn't eating a ton of these foods. I was like basically like detoxing and making sure that all of my bile ducts were open, my stool was clearing. I was doing like I became kind of obsessed with coffee enemas, like, and just like how good it felt to get that shit out.
Have you done a Tudka enema?
No, I haven't. But you actually, through Matt, indirectly, introduced me to Tudka. Yeah. And I love Tudka. And I'm on it now and feel great on it. And I've recommended it to like quite a few of my patients through Body Bio, who I have an account with.
Yeah, that's what I used to.
Yeah. And it wasn't part of my protocol at that time, but like diatomaceous earth, some bentonite clay, like all of that for
You did bentonite clay during that? Wow.
for clearing. I didn't do like an enema with that or anything.
Yeah.
But like had to be in order to make sure that I was clearing that stuff out. And okay. And then like reseeding with healthy bacteria. And I kid you not, when I first started taking probiotics, I could tolerate like that much probiotic. If I didn't like half a capsule.
Did you retest before you started populating?
No.
Okay.
I didn't.
Yeah.
And I've never like fully retested.
It's because they're
pricey. And like I was in chiropractic school. I just spent like probably $2,000 on this whole protocol. So therefore I was determined.
Yeah.
And then, I ended up, you're in school, you're learning to be a doctor, you're in test, you're in stress, you're like constantly go, go, go.
Keep chatting.
And my symptoms were like resolved and I started to feel healthy again. And like, that was kind of the first step on this journey. So like, I know that it's possible.
Yep.
Part of the issue came up later was the fact that I did have like chronic underlying benign positional paroxysmal vertigo. So from that concussion, I think years ago, I ended up having a form of vestibular issue, which was like chronic and kind of not a non-issue. My other issue as a kid was like I had chronic ear infections and chronic antibiotics. So like every time that happens, like 2-3 tabs of an antibiotic and everything is gone, you guys.
Yeah.
And like everything is allowed to regrow. Yeah. And like there are simple things that you can do to help a child's ear actually like drain into the back of their throat and get rid of the bacterial overgrowth. It's like stick your hand way back there and swipe and just clear out the eustachian tube. You could prevent your kid from needing antibiotics. Like we don't need to give that many antibiotics to our kids or our adults. Like they have their use. I'm with you. Educate yourself. Use medication when appropriate. Oftentimes it's not necessary.
Yeah.
What I do in our spare time that we don't get paid for, researching and educating ourselves so we can get our patients or our clients to like the tests that they need to get the treatment that they need. And oftentimes it's not just like a big sweeping generalization like IBS, IBD, ulcerative colitis. It's something more specific.
Yep.
And then that specific issue is causing globalized problems. But like, treat the specific issue and then like the rest of it is kind of like flipping switches and turning the lights back on.
Yeah. Well, I say there are some instances where you do have to treat symptoms. Mm-hmm. So especially when you're talking the immune system. So if we're talking like an overgrowth, we're talking lipopolysaccharides, extremely toxic. Yeah. We're talking neutrophils, we're talking Th2. Yeah. So we have to we
have to downregulate.
Yeah. So we have to modulate this because we can't just keep promoting Th2 to kill because all you're going to do is create further damage. So yeah, you have to go in and I treat. So what I do is I open detox pathways. I usually use Ultra Clear Renew from Metagenics to get those detox pathways started.
What's in it?
So lots actually. So like lots of B complex, all in methylated forms, N-acetyl, quercetin, turmeric. So all those things, of course, that are going to push Th2 initially, but once again, you modulate. So it's like, it's going to support all three phases. We got superoxidized dismutase in there. We got some, like I said, NAC for phase 2, the B vitamins for methylation. I believe it's got taurine and choline in it. So clearing out the biliary ducts. Doesn't actually contain bile in it, but it a lot of like, bile supports and everything. So I'll use that obviously with specific foods and I'm also, a lot of people are very unfamiliar with this, but I use a lot of training modalities to stimulate things. So are you familiar with metformin?
Yeah.
So metformin, for those that don't know, stimulates what's known as AMPK, which is going to, keep it simple, say upregulate glucose partitioning. So that's how it decreases insulin levels.
Metformin is a drug.
Yeah, metformin is a drug. Yeah, I should say that. But obviously, like any drug has its side effects.
Yeah.
I can use a training protocol that stimulates the exact same response without side effects.
Cool.
That exact AMPK molecule. So when I have individuals like this, we need these carbohydrates, especially because, I can't lose weight, so I'm just going to starve myself from carbohydrates. So then most women are scared to increase carbs, mainly because they've been eating such little calories. So that instant caloric surplus is going straight to estrogen, creating water retention and bloat, which they think is fat. So I use this AMPK. I actually have a video I did on my YouTube, 1,500 grams of carbs I ate, and I gained 6.6 pounds in 5 days, but I was like twice as lean and twice my size. It's temporary because it's just glycogen, right? And like some sarcoplasmic tissue, but that's just kind of like what I use. I'll use those training modalities, or I'll use systemic training, it's called. So I can actually improve your detox pathways in your liver capacity by increasing the mitochondria within your liver. So use less cortisol to respond to stressful situations, whether that be walking upstairs, fighting with a significant other, or recovering between sets in your workouts. And that's just creating a lot of acid globally and then making sure you're recovering properly.
So by like training, are you talking about like personal training? Like that's exercise comes?
Yeah, so I'll put in the programs there. So like not everybody has to do it, but a lot of people like to work out. So then I'll take over that training. So for example, I have a client in Pittsburgh. I think it's Pittsburgh or Philadelphia, and he's like just mycotoxin riddled. But he's got a really good physique, but he's got what they believe is all sort of colitis. And he's just like, no, I'm not going to get into that anyways. He trains 6-7 days a week.
Dude.
And I'm just like, you can't be doing this. Like
even like, so the DNA company, what I really loved from them was like, they give you your optimal number of rest days, your optimal number of like hours or time that you should be working out. What time of the day should you be working out? Like, should you be working out in the morning or like later in the evening when you have higher levels of testosterone, so you can actually build muscle to display, like to help regulate your hormones, which is me. And then like 45-minute workouts is optimal for me with like 2 to 3 days of rest or 1 to 2 days of rest in between. And you're only working out 3 or 4 days. And like, once I started doing that, and like I do 3 full body days in a week, and like 2 days where it's more just like glute focused, like shorter circuits. And like my body has been in the best shape just doing that. And like, I'm not in the hour or not in the gym for 4 hours a day, 4 days a week. And like all of a sudden my body is responding well.
Yeah.
Like, you can't be overtraining and putting yourself into a state of like chronic muscle regeneration. Like there has to be time for the breakdown and the recycling and the detox and the clearing to actually happen if you're going to build.
Right. Well, then you got like fat loss, we'll call them patients.
Yeah.
They think some of the best fat loss results I've ever brought clients are ones that barely work out, because people understand training is inflammation. Inflammation will inhibit the ability to get fat to the mitochondria, because you have to run it glucose in the cytoplasm is how I explain it to people. So like you exercise too much, you're actually, never mind the hormone decrease, never mind the decrease in thyroid output, the increase in cortisol resulting in pro-inflammatory reactions.
Yeah.
But you're creating an inflammatory stimulus, which yes, the body adapts to stress. But I always say it's not what you do in the gym, it's what you can recover from. So you can work out 6-7 days a week. Doesn't mean shit if you're not recovering. But the kicker to that is we are miraculous meat suits. You are designed to survive. So this is why people eventually get results doing that. They may feel like shit, but then they get muscle or something because the body's like, okay, you know what? I'm sick and tired of you beating me up. I need to do something about this.
Well, and like if you're not eating well, like you're eating like a 5-year-old and you also sleep like a 70-year-old, like 2 things that you can work on to help you actually recover. Like feed your body foods that are anti-inflammatory, that are going to help you actually like build muscle, like eat adequate amount of protein. I don't care necessarily where you get it from, but we could talk about that. And like
not
eat
nuts.
enough. Not nuts. Nuts are fat in our world.
Yeah, your peanut butter is not your protein, okay?
It's probably full of aflatoxins. So.
that in itself, like that's an interesting conversation to have with people, because like just speaking on terms of peanut butter, like when you're talking like oxalates too and histamines and everything, and like it's so difficult because a lot of people think that I shouldn't say won't give. I try not to, my goal is to have no restrictions. I don't like demonizing foods, because we're in a society where it's like,
everything's a demon.
right? So like, I think I can't say his last name. He wrote the Genius book, Max Lagerver or something. I can't say his last name. And then with Mark Hyman, Dr. Mark Hyman, they were just trash talking the shit out of like steel cut oats or something like that, talking about how much it's going to raise blood sugar in the morning, which understandably so due to poor sleep, etc. But the thing is like, now what you just did was you got somebody watching your Instagram post who loves their protein steel cut oats in the morning. You just stressed them the hell out. Because now they're going to be like, what do I eat? Right? What do I eat? And then, so I try not to demonize. I try to set your body up that you can enjoy that steel cut oats or that you can enjoy that peanut butter. But there might be a time and a place where it's like, all right, it's not that you can't have it, but maybe we shouldn't have it right now.
Maybe we shouldn't have it right after the workout.
Yeah. Like maybe.
Don't give yourself that right after your workout.
Like it's, you know.
Before bed.
It's one of those situations where I also try not to give it. Because what's the number one thing people are going to cheat with? Peanut butter, right? Peanut butter, dark chocolate, right? Everybody hates dark chocolate until they start eating it. And then you get that acquired taste. And all of a sudden people love I can't have dark chocolate. I will eat the shit out of dark chocolate. So I have to keep it out of the house. Like,
have you heard of moderator versus abstainer?
No.
It's like personality types, I guess. You sound like you have to be an abstainer.
It depends. So I eat 8 to 9 meals a day to keep, not meals, just like snacking or whatever. None of that stoke the metabolic fire BS. It's just to keep my adrenals calmer and keep my dopamine up. Because I'm a very energetic, hyperactive individual. For the most part, it's calmed down a lot since focusing on the gut and the genetics and everything. So I eat frequently because then what happens is, so I had an instance when I was younger that kind of like really programmed my brain that bigger is better. So if people were going to love me, respect me, believe in me, etc., I had to be huge, right? And I got heavily addicted to testosterone. So I was doing over 5 grams a week of testosterone. And how I'm alive is, pour everything, pour brain, all that kind of stuff. That's where I learned a lot about dopamine, or like later in the fact, I always explain to people, learning about neurochemistry has really helped me empathize with people. Because like take bipolar, for instance, when I learned that people who are bipolar are literally just trying to build dopamine. That's where roid rage comes from, because testosterone flushes dopamine and all these roid guys think they need to tank their estrogen for some freaking reason because they're so worried about gyno. No, maybe open your detox pathway a little bit and you don't have to worry about gyno. But so that bipolar is actually somebody just trying to build dopamine. And so then I empathize with that more. I don't justify it. I don't say it's okay. But all right, you're not crazy to me. You got a gut issue. Yeah. You've got a concussion. Yeah. You've got, your vagal tone is poor, right? And that's how I kind of empathize now. It's funny, this is getting in my head. It's like when I really got big into this, how most men will like look at a girl's butt and be like, look at that butt. I'll look and like, I kind of think she's doing her squats wrong. Like that's how I view it now, right? So your whole life perspective changes when you begin to learn these things. So a question for you, how much has that affected you negatively? Whether it's stressed you out too much, whether it's made you judge people and think less of them, like how much has that affected you?
Okay, wait. The question is, how much has like my knowledge? Your
knowledge and your experiences and everything. It's hard to separate, isn't it?
Yeah. Because I do the same thing you do at the gym, where it's just like, oh man, the way that she's carrying herself, she has low back pain. Oh man, the way that she's carrying herself, like I know that she has had, I know that like from a person looking at me, if they've had a concussion sometimes because of the way that their eyes are seated in their orbits and the way that they tilt their head as a compensation. Like there's a pathological ocular tilt reaction that you have when you've had an injury to one of your vestibular systems, and one eye goes high, you tilt your head towards it. The other eye, whatever, it doesn't really matter. I'm getting into some weeds.
So like a lever action, would you call it that?
Well, yeah. So like when I tilt my head to the left, my left eye should elevate in order to stay on plane with my right eye. If during a concussion there's been damage to those pathways and you tilt your head to, say, the left, but the right eye is higher, that's a pathological reaction.
So what about, so I have a separated shoulder.
Yeah.
So this guy is messed up. I never did go for surgery. I kind of want to. I really should, right? So I wish I would have broke my collarbone instead. So like if I stand, you'll be able to pick it out for sure.
Sure.
It hangs out lower. So that's why this lat is bigger than my left lat, because obviously that arm can reach out further.
Mm-hmm.
So how much does that impact the brain action when you're talking about the things that you do with the people that you assess and how you fix them? Because for example, like I'm going to lean this way.
Yeah.
Because of this trap being all messed up. Like afterwards, I'll get you to feel them and you'll feel like it's insane, the difference.
Yeah. I mean, was the shoulder separation the only thing that happened, or did you also get a whiplash?
It was snowboarding and it was football tackle, pretty much. I football tackled, groomed run. And so I hit didn't know I separated my shoulder. And I went to undo my bindings, and as soon as I realized I had no function in my arm, I was like, just started hyperventilating and freaking out.
Oh my God.
And yeah, and then I actually dislocated this one, which was 1,000 times more painful than this.
Oh.
But like I was back in the gym after 3 days because I knew all the rehab already and everything.
Nice.
But yeah, I couldn't tell you if it was whiplash. I couldn't tell you. It just happened so fast, right?
Totally. And like, so the question was like, how does that shape what I view? Like I can like head tilt, shoulder being depressed. Like I could look at your shoulder and be like, okay, maybe your cerebellum, which is the little butt off the end of the brain that controls muscle tone, isn't working as well on that side. But then I take a history and it's like, oh, well, I have a shoulder separation and I've actually never appropriately rehabbed that shoulder and I've built muscle around it. And generally speaking, it's fine. Like that's going to shape my assumption, right? But when it's made me a lot more of a compassionate driver because the roads are created so terribly here. Like you can tell that people have been in a lot of
driving,
literally driving,
yeah.
literally driving a car. Like people are like, I have a lot of patients who come in from the country to like rural areas to come and see me, and they are terrified of driving like downtown on 17th Ave where my clinic is located. It's just stop go, there's people everywhere. Like it gives them so much anxiety. You see those people like in the residential areas, they take a corner at like 2 kilometers per hour and you're like, yo. But at the same time, I have to think like, okay, something has happened to make this person extremely anxious in this situation. Or people who, like, I don't have that much compassion for people who rage drive around these people because it's like you're part of the problem.
Yeah.
And also you probably don't have really great inhibition of some of these angry urges you have. And maybe that is from a concussion. Like we see them change personalities all the time, right? So I have a lot of compassion for like areas like Calgary where the driving is pretty complex and there's a lot of really challenging roadways. What else has it shaped? It shapes the way that I like people watch at the airport.
Yeah. You know, so I'll comment about the driving part.
Yeah.
So when I was like on that ridiculous dose of testosterone,
Yeah.
I never get road rage.
When you were on it?
Even on testosterone, no, I never get road rage.
Oh, that's good.
Yeah.
So you do take your chill pill before you.
Yeah. I don't know. I like driving.
Yeah.
And so maybe that's why it never bothered me. But I did when I was younger. I took things out on my car though.
Oh.
So it wasn't like I'd be driving and someone would upset me.
Yeah.
It was something upset me within my home, a girlfriend or whatever, and I would go and take it out on the car per se.
So you would go for a drive to cool off, or you were like slamming on the brakes, slamming the car door, honking your horn,
all that,
you were
pinning it, yeah, all that, yeah, kind of thing, yeah.
So you didn't have road rage per se, like you weren't.
Yeah, it wasn't like the actual other drivers, but I would, yeah, but I would take it. Like if somebody upset me, that was how that was my chill pill was because I used to race cars.
Okay.
Like actually race cars at a track, not some douchebag on the street kind of thing.
Yeah.
And so you'd get in and that was your relief. Yeah. But now that I've been speaking with you, it's, well, what's going on? You're right. What's the sensory? Maybe
peripheral vision. Can they even take that?
So I'm going to change how I feel about that now. I'm going to completely change how I feel about that now.
Yeah, let me know how it goes. Take some time.
See if it's possible. Yeah.
Tell me again though about your like about the dopamine issue for you? Like you create too much or not enough?
So it was not enough because I was also heavily addicted to hard drugs and everything as well. So I was trying to build that dopamine. My catechol-methyltransferase gene was shot. So and plus obviously 5 grams of testosterone. I just opened the Hoover Dam for my dopamine. And then when you look at my actual enzymes, a lot of them were sped up to shuttle everything towards adrenaline. So I would deplete my dopamine and push it all towards adrenaline. Then 50% of that adrenaline's going through the gut, compromising my mucosa lining, feeding my pathogens, further creating this neurotoxicity, further decreasing this dopamine production. And so then I was bipolar. I had rage fits. I had all that kind of stuff. And then when I learned about it, I was like, yeah, you're crazy, right? You're defined as crazy, but it's like, oh no, that makes perfect sense. So if I go off and like I eat like crap for a week, and the next thing you know, like I'm really upset at you that you showed up 10 minutes early, I go, oh, you're just looking for dopamine right now. You know what I mean?
That was where it was going with the like racing cars and trying to
you're just building dopamine, that adrenaline. Yeah, you're just trying to build it.
And I find a lot of the times actually.
Same with travelers.
Yeah.
People who travel all the time.
Also, same with like kids who act out in class.
Oh my God. Don't get me started on children. Like microbiome, dopamine, ADHD.
Being on a tablet that goes up and down all the time and driving their midbrains through the roof and being in convergence all the time.
My niece, we came, bless her heart, love her. It was last Tuesday because she loves Guardians of the Galaxy, and I freaking love Guardians of the Galaxy. So have you seen the new one?
No, not yet.
It's amazing. You're gonna cry. You're gonna cry for sure.
Thank God.
You're gonna cry for sure. So she came here, and okay, granted she was in a cast, didn't want to come for a walk, understandably so, but the whole time,
yeah,
it's like, does your neck not hurt? Like she's just on her phone.
It will.
Nonstop, and I'm like, geez, kid.
Yeah. Not only is the blue light overstimulating your midbrain, but the vertical up and down movements over.
I had glasses here somewhere. I have blue light blocking glasses all over the house.
I mean, during daytime it's fine,
yeah.
But like during those melatonin producing hours, which I've seen you do posts about, it's super critical.
Yeah, for those that don't know what she's talking about, is blue light will suppress melatonin production in the evening.
Yes, and blue light is what we're supposed to take in during the day. You can think of the sky being blue, right? Daytime blue light, totally normal, but excessive amounts of it is going to be too much and suppress our melatonin production.
Doesn't it damage retina too? Is that what they claim?
Speak to that because I don't know.
Yeah,
but I like to look into that. But like our midbrains, which are again top part of our brainstem, help us perform vertical eye movements, but also drive our sympathetic nervous system. They take in light and sound. So like a bright flashing light, you must figure out where that's coming from. You could be in danger. They take in sound. It takes in sound as well and drives our sympathetic nervous system, like a loud bang, right? So overstimulating our eyes with abnormal amounts of excess blue light can drive our midbrains up and put us into that fight or flight state. And like I should also say, like overstimulation of a nervous system area or pathway can cause it to fatigue. And when neurons fatigue, it's not like muscle cells which like rip and get stronger. Neurons die. So we recycle something like 10,000 neurons a day. Like it's totally normal for us to be recycling and replenishing. But for somebody who has had like a concussion and has an actual disruption in this part of their brain, they might become like extremely light sensitive because that area is so overwhelmed already that it becomes like hyperactive. And then all of a sudden, like having a big light shining in their eyes would cause them to be like extremely symptomatic after a couple of hours. Or have a massive headache. It's not me. No, it's fine. But like doing that, scrolling through like social media, scrolling through YouTube, scrolling like whatever kids are doing on their tablets and phones. Like I've seen 2-year-olds work these tablets. Like they're incredibly smart. And then they stay there like this close and their eyes are pushed into convergence. Their little midbrains are still developing. Like midbrain is the part of the brain that controls a lot of these reflexes that we have to like, how do I describe this? You're born with primitive reflexes. Primitive reflexes are kind of there to help you stay safe and survive. So like you stroke a baby's cheek, they turn towards you. You stroke the baby's mouth and they suck or like root, right? For breastfeeding. You stroke their hand and they have a grasp reflex. Over the course of their development, while they're like rolling around on the floor or following you around, they develop these visual pathways and these vestibular pathways, and they learn how to control different sides of their body with like crawling. They learn how to stand and be up against gravity and move their feet. And they learn how to have good balance with and like stimulate their cerebellum. Well, all of these reflexes require like a healthy midbrain to enable the pathways to like, it's a sensory stimulus coming in, okay? So like, sensory stimulus coming in, stroke the hand, right? Goes to the brain. Initially, the reflex is just to close and grasp the hand. Over time, they learn to have good control of their extensors, and you can stroke their hand and they won't have that reflex. Well, that took sensory information coming in, processing in the brain, motor information coming out, and it involves the midbrain. If you overwhelm the midbrain, we're not going to end up basically acquiring all of these motor reflexes that need to be present in order for us to develop additional reflexes like how to communicate, how to have good attention and focus. Like our frontal lobe is like developed through movement. And if we don't overcome those primitive reflexes, we end up with kids in school who have attentional issues, who don't know how to communicate, who can't focus, who can't follow along with the teacher for more than 5 seconds without completely losing focus and acting out because they're looking for dopamine from that dysfunctional midbrain.
Yeah.
So like I have kids who come into my practice who have, oftentimes it's like a lazy eye.
Okay.
Okay. So that lazy eye is coming from poor vestibular and visual reflexes that were not developed appropriately. Super often it's because the kid didn't crawl and they went right to walking, and they like didn't learn how to control their head and their body and their eyes in this like pattern that crosses across the spinal cord. So this half of the body is controlled by this half of the brain. This half of the body is controlled by this half of the brain. And then we've got vestibular inputs and visual inputs that kind of go into both sides of the brainstem. And so if we skip specific movement milestones, we actually won't develop parts of our brain which are going to prevent us from succeeding in like a rigid environment like a classroom because they're quite rigid. And that's why like play and movement is so important to development. But like we don't do that anymore. Instead, we put our kids in front of a fucking screen.
Yep.
Where they don't have the opportunity to like develop these movement patterns. And maybe they weren't even there already because you stuck them in front of the screen at 2 years old during this prime time when, you know, that kind of stimulus might have caused them to regress. Like these are all reflexes that stay within our body. I've seen them come back after concussions. Like you can injure a part of your brain that's involved in inhibiting that reflex and you can have it come back. So they're always there. Mm-hmm. I've seen it happen with a kid who had celiac. Her mom had celiac, and the doctors told her, like, if you have a baby, she's most likely going to have celiac disease. Well, they didn't keep gluten, or they kept gluten out of her diet until she was 2. And then I think they gave her like a birthday cake that had gluten in it or something. On her 2nd birthday, that eye went in. And then,
really?
Yeah, from that inflammatory response.
Wow.
Driving her midbrain.
Yeah.
Because it drives your stress pathways.
Yeah.
And so they're trying to give her glasses. They're talking about surgery. And she like reached out to me and was like, hey, do you think there's anything you can do for my kid's eye? I ran her through some of those tests. I checked out her primitive reflexes, and she was a wicked smart girl. She didn't have any behavioral issues. She was like, you know, super great in that context, but she's only like 5 or 6 years old right now. And we got her doing those primitive reflex exercises, and I told her to take gluten out of her diet, and like fixed.
Yeah.
Like insane. Mm-hmm. So like how many dysfunctional brains are we creating just by having this be like our daily habit.
Yeah.
For kids and adults.
And adults, yeah. I can be guilty. I get caught up in that thing a lot.
Totally, me too. And like I get off of it and I'm like angry at myself.
Yeah,
I'm like,
idiot.
what?
You know better.
You have to go to bed. You have to shut off your electronics. I'm all for shutting them off. Like I hate TV in the bedroom. I don't like my devices on like for an hour to an hour and a half before bedtime. And like I do find that it affects my sleep. Like I will wake up in the night. I will feel less rested if I do it. So like I'm so sensitive to it that like I get frustrated because I'm like, oh, I really needed the good sleep tonight. And now like I'm my own worst enemy.
Yep. Yeah, we all are, I think.
Yeah.
So I want to talk to you about something and see your view on this. Because you're talking like primitive and brain, etc. Yeah. How I kind of explain people, because obviously when we're in a stressed out state, we're more amygdala driven, right? And then obviously when we're rest and digest, we are more prefrontal driven. How I explain to people what the difference between the amygdala is, a lot of people laugh at this. I call the amygdala the ooga booga brain. So cave people, right? That's why people are dumb when they're stressed out and they just resort back to primitive.
We're very reactive.
So how I explain that to people is amygdala is your need, prefrontal cortex is your want. So then they go, what the hell does that mean? If you see a bowl of ice cream on the counter and you're thinking with your amygdala, you're like, I need that ice cream. I need the most calorically dense food for the least amount of work. Where when you're thinking with your prefrontal cortex, you're like, I want that ice cream, but I know I don't need that ice cream. So that's how I kind of explain. So that's like, yes, the other physiological mechanisms of like cortisol and potentially feeding into things like candida and altering brain chemistry and dopamine to drive cravings and whatnot, but also all that in conjunction is going to stimulate more of amygdala. And so then I explain to people, okay, this is why you binge eat. Like this is what it leads to. And so, because I've been there myself, like that mycotoxin exposure, I ate everything. Like I got triggered once. And I think we calculated it was over 120,000 calories worth of sweets in 1 week. I put on 22 pounds. So it was actually when I got down to single digit body fat. So I got down to 7%, but like when I was hovering around like 9, that's I think 8 or 9, that's when it happened. So I could have got even leaner, but then I put on 22 in 1 week and then I lost 18 the next week because obviously water inflammation and gut and everything. But I had like a severe breakdown, so bad that when I was like either at Tim Hortons waiting for a donut or I can't remember what the bakery was called in Red Deer because I was managing a shop in Red Deer at the time. There's a lot of stress that was happening. I would start vibrating. No, not the donut. I didn't like the donut mill. It wasn't donut mill. I can't remember what it was called. It was a lot of Nanaimo bars.
Oh my God, my favorite. So, I'm a Nanaimo bar connoisseur.
I wouldn't say I'm a connoisseur, but I do love them, but I don't know shit about them. So
no, I just go around and I'm like, oh, you've got one? I've got to try one. Everything goes up currently against the Rocky Mountain Bagel Co.
Rocky Mountain Bagel Co.
Yeah.
Like for the Nanaimo bars?
Yeah.
Really?
I think they have the best ratio.
I'll have to try it. But anyways, I had this, I would freak out. And like, I even swore at one of the people one time. So I'm like, hurry up and get me my fucking Nanaimo bar or whatever I was going for. It was bad. Then I did hypnotherapy.
Ooh,
so
I love it.
I did hypnotherapy initially. I had a very bad relationship. It was a very bad incident. And so I just couldn't move on. And I can't remember how I even came to try it. I'm a very open-minded individual though. So I was like, okay, I'm going to try hypnotherapy. So I went in there and the first session felt like 5 minutes long. And I come out of his office and into the world, and I felt like I just got out of prison after 30 years, never seen the sun before. It was just like this new vibrant feeling of life. Wow. Second session felt like 5 hours, and I just cried my eyes out. For like a week, I was the most miserable human being ever. Then my friend, he was like, okay, like 'cause my third appointment wasn't up yet, like I hadn't gotten there yet. He was like, let's just go to Banff and we'll just take the kayaks out, go fun. I'm like, no, I don't want to do this. And he was just like super, super persistent. And so I eventually went, still in this miserable mood where they're inflatable kayaks. So as we're pumping up the kayaks, I'm still in this horrible mood. As soon as we got onto the water, it was like all emotion was gone. All emotion was gone. It felt like I literally just dropped off a 7,000 pound vest. All of it was gone. I couldn't believe it.
Otolithic stimulation.
Yeah? What is that?
Your otoliths are part of your vestibular system.
Okay.
And they detect how you are moving against gravity. So translation, forward, back, side to side, up and down, driving in a car, rolling side to side on the water. water. Very like they're going to activate your cortex to help you understand like where you are in the world.
Okay.
So that's kind of like your immediate, from my perspective, your immediate like chill pill.
Wow. That's really cool. Because, yeah, that was what it was. Like, as soon as we hit that water, and then I went back to the third session. Yeah, fair enough. I always say people get out by water. That third session, once again, felt like 5 minutes long, and I was just a whole new person afterwards.
I love that.
Like, it was amazing. But when I went the second time for the eating issue, we were going after the wrong thing.
Oh. How did you figure that out?
So, as I mentioned, I was managing a shop at the time, and I was seeing this woman, and then my business partner was... It was a nutrition, tanning, massage, hair. It was big, but I was managing it while building this business, this big thing, and it just wasn't a good situation to be in. And I realized that afterwards, which is why I left.
Gotcha.
But what happened, what triggered me, was it was my grandmother's birthday. I don't recall the restaurant in Red Deer, Ranchman's maybe, or I don't know. Anyways, I had brought this girl with me, and there was lots of us at this table. And my grandpa's never really believed. He's starting to, because you can't deny my success, the results that I brought people, but he's never really believed in what like you or I do.
Yeah.
Old generation, old stubborn asshole, right? So yeah, right. So I thought he was actually listening to me. And so I was going off like just with pure excitement and joy. And he's like, hold on. And I was like, okay, what? He's like, he looks around, he's like, is anybody else actually even listening to him? And started laughing. And it just triggered me because I was obviously, getting lean at that point. So my nutritional protocol was a little stricter. So I ate like 15 desserts. I kept eating everybody else's and everything. I went and got ice cream. I drank a bunch of alcohol that weekend. I had so much food in my stomach. Like you could just hear everything sloshing around. And then it went into the week. And so like when I went, it wouldn't stop. So like a very like good friend of mine was like, I'm sending you back to hypnotherapy, right? So I went to hypnotherapy and it didn't help. It didn't help, but it's because we thought it was my grandpa. And it wasn't, it was my business partner. So once I realized that, it just gone. Once I realized who was actually driving the trigger or the stress, however you want to look at it, it was gone.
Yeah. A lot of these things do end up being like different energies in our life that cause us to get into these different states of stress or like energetic confusion. And like we start just like, again, getting confused in our own brain about like what's important to us. Like I can totally understand where you were at with that because you go after the wrong thing and it just doesn't help, right? It's like anything. You go after, like people will see other practitioners trying to treat their concussion and they're just like, they'll see vision therapists, for example, who are going to like bring their eyes together and usually see a convergence, like the eyes coming together, insufficiency. So one eye doesn't come in efficiently enough. Oftentimes it's actually the opposite problem. And one eye spasms and gets stuck in this convergence position. Well, when do your eyes come into convergence? They come into convergence when things come close to you or when you come close to things, right? So if that eye gets stuck in convergence, you're going to constantly be thinking something is coming at you. So people oftentimes have issues with driving because they feel like the world is constantly coming at them. They get really overwhelmed in like shopping aisles. They do have depth perception issues. They feel like one eye just kind of like shuts off and they're constantly anxious and like for no reason. But we're human, so we're constantly trying to like attach a reason to why we feel anxious. So they go to therapy or they go to vision therapy where they get them to do pencil push-ups for that insufficiency that they saw in the opposite eye. And now you're just winding up this convergence spasm and making the person worse. But they're like, well, then you just got to do it more. And it's like, that's not the answer. Like, figure out the problem and treat it successfully, whether it's the person in your life, whether it's the actual eye issue that wasn't able to be seen bedside and needed goggles to see it, or something else. But like, I don't know, like the more I do this work, the more I realize, and like oftentimes my patients have come in and they have had traumas in the medical system. They have had relationships in their life fail. The sicker they've gotten or the longer they've been sick, the less tolerant people are of them being sick. And maybe those people are still in their life. And like oftentimes I can get them kind of, I say, out of the ditch of disease, if you will, and like help them climb up the mountain and get up on the other side. And like the goal is to build bandwidth, right? So little things don't make you slide back down into the ditch. We want you up here kind of on the plateau so that even if something stressful comes along, you're not pushed to slide back down. You can still stay up here. You just might not feel great for a little while. You build resilience, right? But like oftentimes, not often, sometimes, like people always ask, like, is there anything you can't treat? Because oftentimes my work is good for a lot of things that I can't necessarily tout about because I'm a chiropractor, but it's good for a lot of things. And yet there are some times when it's not appropriate yet, or it's not appropriate at all. And like you have different work to do. You have to go see a hypnotherapist. You should really be seeing like an actual therapist. You should be cutting somebody out of your life. You should be doing these other things that are actually causing you to stay down here more than you think.
Yeah, and that's the hard stuff though. So nobody wants to do that. They would rather go to you and say, "Okay, put your machine on me."
I'm gonna turn the mirror over to you.
And you're gonna be better, right? And so, like, I had that conversation. I think I say that whenever I talk about stress management. I always do the wink, wink, like, yeah, leave somebody that you shouldn't be with, or because how many times is it relationships that are causing all these issues within people, right? So in your experience and everything, what's your stance on the placebo effect?
It's a real thing for sure, but you can't placebo your way out of a relationship.
So what I always say, because I hate it when people go, oh, it's just the placebo effect, you're wasting your time or money. And I was like, if it works, it works. That's all that matters.
Yeah, I'm with you.
Right? And because there's a recent research done on like women in training around menstrual cycle. And the research shows it doesn't matter unless you believe it does.
Really?
Yeah. And so this is why I personally put emphasis on this. But if I have somebody coming to me, like obviously a female, and says, hey, you know what? I actually find that I'm stronger during
menstruation.
I'm not going to go, well, the research says this. I'm going to say, okay, this is what we'll do then.
Cool.
This is what we'll do then. Because if you believe that, I'm going to fuel that as long as it's a positive thing.
Yeah.
I'm going to fuel that because that's where I always have the conversation with people. Let's go back to the peanut butter.
Right? Let's go back to
if peanut butter means you're going to put 90% into this protocol rather than 65, I'm going to give you the peanut butter.
Totally.
I'm going to give you the shitty coffee.
I'm going to meet you where you're at.
Yeah.
Have your shitty coffee, but maybe not out of a Keurig because they're usually full of mycotoxins.
Yeah, right? Yeah, who cleans that shit? Nobody.
Open that up.
Tap water plus not cleaning recipe, and we wonder why. Like where, because obviously you enjoy your coffee.
I do.
Because I'm such a stickler with coffee because one, like it suppresses TH1. Two, if you're not methylating properly, I always explain, because coffee obviously is going to speed up phase 1 detox, but if you're not doing phase 2, you're running into a wall, right?
Yeah.
Also, I'm not sure how familiar you are with like the CYP enzymes and estrone, estradiol, and estriol, but caffeine can speed up the conversion of E2 to E3, which yes, estriol is anti-inflammatory, but you're also draining out of your estradiol now. So you're taking away from that queen bee estrogen. So then I get like a really big stickler with caffeine, or people have caffeine at 5 a.m. and then not sleep at night. How I explain that is research claims caffeine doesn't raise cortisol, which I do believe, N of 1, in some individuals it does, but it is proven throughout everybody that it doesn't help lower cortisol.
Yeah.
So I explain cortisol as a teeter-totter. So if you're pushing, you're bringing it up in the morning, this is where that afternoon crash comes from. Yeah. So how many people do you know that have that afternoon crash but then can't fall asleep at night? Because it's working like a teeter-totter.
Yeah.
So the next thing you know, they finally do whatever it takes. They smoke some weed or whatever, screw up their dopamine. Teeter-totter again.
Toxins.
So then they wake up at 3 a.m.
Yeah.
Right? Liver. Is it liver or is it just cortisol and adrenaline?
Right.
Right? Yeah. Okay. A lot of people, you can say liver. Yeah. Especially in today's environment.
Well, and especially if you're using alcohol or weed to try to get you.
100%.
Get you, like, that's when your liver, sorry, I don't know if people know, but like with Chinese medicine, they look at the organs as functioning on a clock. And oftentimes between the hours of 2 and 4, your liver is most active.
You know, I have my TCM, eh?
No.
Most people don't know that yet.
Cool.
Yeah, so I took TCM courses and everything. Do you know Dustin Nelson from Chicago?
No. No.
I learned through him.
Cool.
Yeah.
I love, like, there are so many different facets of.
You know, I love the most about Chinese medicine is the names.
Yeah.
Buzhang Yizhuan. I just love saying them.
Buzhang.
Yeah, I just love saying the Chinese names. But actually, so I want to go back. I'm trying to think. You mentioned something. I probably won't be able to quote you, but it was along the lines of, so I'll give you an example. Are you familiar with like lymphatic massages?
Mm-hmm.
So they get a lot, it's like a lot of, shall I say, hoax or BS, and a lot of like people think they're garbage, right? Well, how I explain that, the reason why, it's like, actually I'll use a better example because people kind of laugh. You know those things that you stand on that shake your butt and like infomercials claim that you lose weight? Oh, yeah. There is actually validity to those machines in terms of moving the lymphatic system. Yeah. But the thing is, you can't just hop on that and then go after you're done, you feel satisfied with your workout. So you grab a beer and you sit down and watch TV. You still haven't really ate much for the day, right? So yeah. I explain it all as like a pyramid. You got the mitochondria, you got the cells on the top, and then you got the skin, then you got the lymphatic system, and then you got like the liver, and then you got the colon. A very broad.
This is like in terms of like
drainage.
Function.
Yeah, and drainage.
Okay, yep.
So this is where like people think that something doesn't work, but that's because you can't go get a lymphatic massage and then go out and
slug every other hole up.
Exactly. Or I can't think of a ridiculous name for a Starbucks coffee because I don't drink it, but
Frappalappuccino.
Yeah, something like that. And then go stress out about something and then go out for beers. And so this is where like, I wonder in your practice, like, have you ran in, because you did mention that you got pretty good patients coming in, but do you run into that where you do something, you've educated them that, look, if you actually want this to, shall I say the word stick, this is what you're going to need to do, but they don't do that, but then they come back and saying, okay, well, your modality doesn't work.
Yeah, I would get that a lot at the last practice I was at. And like, to be fair, okay, so when you're trying to create plasticity in the brain, the repetition is the most important thing. So you come in, like I would have, when I was starting up here and I was at that practice where I was like an independent contractor and functioning within an integrative, this is in Calgary. Okay. Sorry, I jumped around. So how do I not jump around with this? So if you come in and see me for one visit and I treat you and do some exercises with you, you're not going to feel a long-lasting difference at all. When you stimulate a pathway, it does something different. It operates at a more functional level for 2 hours and then it goes back to what it was doing before. So one round of doing some exercises is not going to create long-term potentiation, which is the actual terminology for what needs to happen for neuroplasticity to take place. Okay. So when patients come in for, a couple of sessions and I haven't given them home exercises to do daily in between, they might say to me like, hey, not feeling any change yet. This isn't working. If I get them doing way better during an intensive and I send them home at the end of the week with home exercises, which every single patient gets home exercises to continue this progress, then they come back in a month and they haven't done any exercises, they're going to regress. You don't get to keep that until you have done the work to actually create enough plasticity in those neuronal pathways so that you can endure stress, you can endure fatigue, you can endure a lack of sleep, you can endure a fight, you can endure whatever without regression. Okay. And it usually takes a couple of months.
Yeah.
For like a concussion patient, that's not a patient who has a neurodegenerative disease that they're like fighting uphill against and aren't taking care of themselves on top of it. Like, yeah. I love the patients who have been taking care of themselves already. They've already fine-tuned like their diet. They know what foods are their inflammatory triggers, and whether or not we start to explore outside of that once we've got their nervous system to calm down, because oftentimes a hyperreactive nervous system is also causing a hyperreactive immune system. Yeah. And so I should say, like, to your question way back at the beginning, are there things that I can do with my work to change like metabolism or change immune function? Absolutely. Absolutely. But like that's not necessarily like an outcome marker that I'm using throughout the course of the week unless it's something really obvious. Like the other week I had a patient who was having like a bunch of like rash flares and we're not sure what it's coming from. And so I sent him out for like Lyme testing to Armin Labs, and like shockingly that came back negative. But I was using my light therapy, so that's something we should
Are
definitely
you
talk
familiar
about.
with CIRS? Chronic immune response syndrome?
Yeah, but I kind of
That's what I have, is the HLA gene. That's why in a moldy environment, I'm like super sensitive to it. So I wonder if you have that too.
Yeah. And like I definitely am more, I don't have a great like environmental response. And I can't remember exactly what the gene is that they did with the DNA company, but I learned that from them too. And this guy's like a heavy duty mechanic. So like he's going to be covered in toxins all of the time. And like oftentimes these people have like a more robust immune system because they're like in it all the time. But then you get a couple of concussions and now you're not so robust. And within the last couple of years, he started to just get these almost, at first we were thinking it was kind of like Lyme related. Now I think it might be IgE or herpes related because like he was doing red light therapy the entire week he was in for his intensive and felt amazing. He also gets chronic like joint pain, and all of that joint pain was gone. He had minimal rashes, like no new ones appeared, and they're not itchy. They're usually just like a streak, like an IgE response maybe.
Yeah, so that'd be 100% Th2 dominance then.
Yeah.
Yeah.
And like, don't get me wrong, he's trying to take care of himself and like,
Can't see it. I got my little panel there. Obviously nothing like that. I can't. No, I'm talking. I got my red light panel somewhere. I can't see it. Yeah. It's just a half one or whatever, but yeah.
So yeah, he was like loving the red light. It was helping with inflammation. It was helping manage that Th2 pathway for sure. And then like he went home, he went back to his life, and like cognitively and neurologically, he still feels great. But now all of a sudden he has like kind of an outbreak of a painful rash on his face. And I'm like, oh, that looks like shingles.
Whoops.
And now I'm starting to wonder if there's like dermatoxins that are in his skin that have been created by shingles, which, you know, can shed dermatoxins and neurotoxins.
Yeah.
So, red light therapy is something that I definitely utilize to stimulate mitochondria, like you said. And so I'll see like impact on cellular, like function at a cellular level, along with what I'm doing with the rehab. It allows them to recover a little bit more quickly because it's actually giving the cells the energy that they need to do their job and to like create neuroplasticity and to detox and to like digest and to get into rest and digest mode and relax and create endorphin. So it like does all these positive things. But certainly after like they leave that environment, I see people kind of like can regress and they're like, oh man, like maybe I should invest in a red light at home. I'm like, yes.
I see my sauna over there.
Yeah.
Yeah. So I got this is my morning routine. I love my morning routine. So I get up, I do my wake and take supplements, etc. Take them for a walk, come back, fire up the sauna. While that's warming up, I'll do like, you know, I have a weighted skipping rope, so I'll do like 10 to 15 minutes of that. Trying to keep the cardiovascular up, so hop in the sauna, come out. So easy to shave my head after the sauna, so I'll shave it then, and then red light therapy. I always finish off with red light therapy, and you were just like, every morning, it's like I've been reborn. It doesn't matter how poor my sleep was, doesn't matter what happens, I finish off that, and it's just like, I feel like I've been reborn. I love my red light.
Your drainage pyramid, did you hit with that?
100%, right? Like, I love my red light. I love finishing off with that.
Yeah.
It's interesting because like I'll fall asleep during it every time, where most people they'll get like kind of revved up from it.
I've heard that, and I am a fall asleeper.
Are you? Yeah.
As well. Yeah.
Well, they claim methylation with that, and I do know my methylation is poor as well. So I take extra methyl tetrafolate and methylcobalamin to help kind of like boost it on top of a B complex.
Yeah.
But I love my red light. I freaking love my red light.
The thing is, though, like you do have to be wary. Like it's like the one that I have at the office is full body. And then I have a couple of units at home.
Is it front and back? Like it's a whole like...
No.
It's okay, just the one side.
Just the one side. And like it is going to upregulate your detox. So you do have to be careful with patients who you think are probably toxic.
So this is leading me to a question I wanted to ask you. How often do you run into somebody who gets worse, but you know it's part of the process?
Gets worse in terms of like their neurology?
Anything. So like you said, if you're doing the red light and you're speeding up detox pathways, you're trying to push everything to the liver, maybe you're missing some key ingredients, or you just need time, congested biliary ducts, whichever, so they feel worse either neurologically, metabolically, or whichever, but you know this is something they have to tough out. Do you ever run into that? Because that's me every single day. That is my job every single day.
It's mitigating.
Like when you start, like when you start pushing mycotoxins and metals and stuff through the gut and the liver, no matter how many binders you got, no matter what balancing you're doing, you're going to get sore knuckles. You're going to, and so like, is that something that you experience, or is it kind of like cut and dry and they usually feel pretty good afterwards and keep up with it?
If they come in for the intensive, then I'm usually pretty good at staying on top of how like well they're feeling. What I will find most of the time is like, as I improve their nervous system, they just generally feel better. As I improve their nervous system at a rate that they can tolerate, they feel better. If I overdo it with exercises, I can make people feel worse really quickly.
Like what would the worst feeling be?
Whatever the symptom that the patients have. So it might be like they feel more brain fog, they feel more eye tension, they feel more fatigue for sure, eye strain, headaches, gut pain, spasticity, if that's part of their presentation, neck tension, like all of those things like increase. And when I do my work, it's actually really kind of cool because like I have to pay such close attention to the exercises to make sure that the patient is consistently feeling better. If I am making a patient feel worse, or if I'm giving them like new symptoms, or if I'm pushing something inappropriately or using the wrong exercise, the patient will feel worse. And oftentimes in things like vision therapy, they're like, well, then you just got to push through that. No, I am not like, you can, but that's habituation therapy. You're trying to rebuild a whole new pathway instead of rebuilding the pathway that got blown up. So I kind of talk about rebuilding like the highway. The highway was 4 lanes. It was sending tons of cars to the city, right? Which is your brain. Then it got blown up. Now 4 lanes is 2 lanes, and you're still trying to send the same amount of information to the city, same amount of traffic.
Call it the Mexican border. Here's what I call it.
Nice. So yeah, everybody is headed to the Mexican border. There is going to be way more car accidents now, and we're actually going to we've already created a bottleneck. That bottleneck is going to get smaller. Those are the concussion patients that never get better because they've had too much of that highway blown up to just get better with time.
Okay.
Right? So then they try habituation therapy. Well, habituation therapy is typically general vestibular therapy or vision therapy, and they're going to try to create like a detour around said pathway, but oftentimes that's just going to kind of allow the patient to situationally like get through whatever it is they need to get through, but their symptoms aren't going to go away. Their symptoms might actually get worse. So when they come in and they've done like 6 months of vestibular therapy, but now they feel like extremely dizzy in the grocery store when before it was like only dizzy on their computer, I know we've created some bad pathways, bad new habits that are not serving the patient.
Okay.
And so my job is to actually rebuild the highway. And you do that with specific targeted exercises, but not so much that it creates a little baby explosion and fatigues that person again.
Okay.
So oftentimes when patients are coming in and I'm using my eyeballs to make sure that I'm not seeing any signs that their body is getting tired or their brain is getting tired, and I let them rest between each session, that's super important, the rest, they're continuing to feel better. There have definitely been times when especially when I got the red light at first, and I've put patients like directly underneath it and put it really close to them. Patients feel really hot. They feel like really overwhelmed. Neurologically, they can't cope with that kind of big temperature change. And maybe they do feel a little bit more sluggish, or their brain feels a little bit like slow, and they were a previous smoker and they probably have a lot of toxins in their body. Well, like, oh shoot, like this might have not been the right move. And we need to bring some antioxidants on board. That's usually my first go-to with stuff like that, because in a week, I don't necessarily have the capacity to be running all of these blood tests and managing everything at such like acutely. And I don't like I have access to full script, so I'll send patients like supplements that way through that online dispensary.
Do you get the 25% off?
Yeah.
Yeah, I gotta set that up still. I only got the 10% off. I gotta set up the 25%.
Yeah, so it's something that I would love to be able to do, or love to have, like, that was kind of a dream, is to have somebody like kind of in the practice, either part-time or like satellite, to help patients manage those issues, because there are lots of, like, not lots, you're obviously unique, but there's people out there who do that, right? There's not many people who do that and do that really well, just like there's not very many people in Canada who do what I do and do it well. There's like 3 of us.
Yeah. Okay. Yeah.
So I don't want to necessarily get so bogged down in that unless it's creating a huge obstacle for recovery.
Okay.
So I usually, like I said, do my neuro rehab as much as possible, get patients as good as I can in that week, which usually gets them like pretty far up the hill. And then after that, if they're continuing to have issues, it's like, okay, like if you're interested, we can do the DNA company, because that's going to give me a ton of information. Or I'm going to get you into the office of a naturopath or a nutritionist who is going to be able to help you be more specific about like holes that need to be plugged. And then when they do that, they continue to see like a ton of improvement.
Yeah.
What I love is the patients who have already dialed all that stuff in, but just need the light switches turned on in their nervous system. Yeah. They get better, like, and it's like night and day at the beginning to end of the week.
Yeah, that's where, because like I always tell my clients now, like, there's only so much that I can do because I'm not physically there to do things. So there's only like so much I can put on paper. Yeah. And yeah, like I cover all the organs. I cover, not in terms of like neuro like you do, but brain in a sense, right? I cover all these modalities, but yeah, I'm not doing the work that you do, kind of idea. So it's like great to have somebody that I can send these individuals. I already have like a bunch of people in mind. And so it's
people in mind for you too.
I appreciate that. So, but I wanted to say one thing too about, because why I ask about getting worse before it gets better. This is how I explain it to people, because most people. Go ahead.
I'm gonna agree that your patients are gonna get worse before they get better.
So this because gut health is, because as we know, you and I know, everything starts with the gut usually. Well, no, it could be concussion that lead to the gut, but then that's what needs to be addressed too. Otherwise, it'll keep coming back, relapse kind of idea. So that's what I use the Mexican border as. When you have people with gut issues and then they do a flush, detox, whatever, you add in more lanes, but you didn't reduce the traffic. So as soon as you stop the medical food or the glutathione or whatever you're doing, it goes right back to those congested 4 lanes. And so that's kind of how I explain that. So yeah, like you said, you're rebuilding the highway. Same thing, but I use it as I'm decreasing traffic. So, but what I explain with the gut health is it's the anthill analogy. So if you go out to the middle of a country, someone's farmland, and you run across an undisturbed anthill, you're going to see ants coming in and out, carrying leaves, doing ant things, whatever ants do, right?
Anty things.
Right? I should know. I used to have a bunch of ant farms. And so, but it's relatively calm. It's a calm environment. Well, if you have gut issues, we got to poke that anthill with a stick. And so then what happens when you poke an anthill with a stick? They go crazy and they go up and they climb, they bite you, all that kind of stuff. That's how I explain gut protocols. Because we have to break apart biofilms. We're talking mycotoxins, biotoxins, metals, mercury, bacteria, all these things are housed and we're bringing it to the surface. Otherwise, we can't get rid of it.
Yeah.
And so that's how I explain it to people. Like, I'm like, yeah, I'm sorry, but you're probably going to get worse before you get, not everybody, but there's an individual, like myself, I went through hell.
Yeah, that's why I said like it was probably a bad idea and a good idea during the hardest quarter to do that gut protocol, because it was like clockwork. Every Wednesday, thank God I had like the afternoon off by some grace of God, because I always felt like shit. I always was fatigued and I just wanted to go home and go to sleep. And I just needed to rest. That was when I learned about the importance of just like listening to your body, and when your body says rest, like just rest. But like, yeah, absolutely. You're going to be kind of fanning the flames of a fire in order to evacuate what needs to get evacuated.
Do you ever do keto when you were killing?
I have to think about that. When I was killing, I definitely had a lower carbohydrate protocol when I was on the SIBO protocol. Although you do have to feed some carbohydrates in order to like pull the bacteria out of the biofilms. But I tried keto after and it totally sucked for me.
So here's what I do. So so we don't push the immune system too far. So this is how two things. I can go as hard and as fast as possible without swinging things too far and preventing the bacteria from adapting. In complex cases, we'll do 2 days of carbs and killers and then 2 days of keto with something like Saccharomyces boulardii, a competing bacteria, and like motility agents, like if you can get T3 medication, for example, right? And then binders. And then that way we're stimulating autophagy. A couple things, stimulating autophagy.
Yeah.
We are giving yourself a break from the killers.
Yeah, which is important.
And we're just decreasing inflammation.
Yeah.
By not feeding into it via like cytokine pathways from carbohydrates. Because I always say that to people, carbs do not cause inflammation, but they feed inflammation, or they shouldn't be causing inflammation, right?
Yeah.
That's how I kind of explain that. So that's the protocols that I use for individuals, and that's how we can like really start to expedite the process. Or when you hit those really hard sticking points where it's okay, like why are you not budging? Why is the knuckle pain not gone away? Why is there still that distension occurring? We go into keto, and after a couple rounds of that, then you really start to see, I should flop around a lot. Then you really start to see the transition in their overall well-being, the decrease in distension. Because for me personally, that's what really got me over that hump, was going into that cyclical approach. Because finally you could see my stomach just like, I don't know if you saw, did you see my post?
I did.
Yeah.
Before and after.
Yeah. And so finally I was able to get that to budge from going into that protocol.
Nice.
So.
Yeah, no, I didn't use those kind of like daily cyclical, or like 2 days on, 1 day off.
Otherwise keto sucks.
Yeah, even like there's tons of research in its use for like post-concussion and using it as a therapy, right? Or using it to prevent epileptic seizures or stuff like that. But I'm not a huge proponent. It's definitely not for everybody. I understand, and I've taken like the keto masterclass from Rob Wolf, and like I understand that there are definitely good ways to do it and bad ways to do it. And even when I was doing it really well, it just like ketones can feed bacteria in your gut. So it was something that I was still unable to do at that time. And it just didn't work for me. I gained a lot of weight. You're eating calorically dense food, and it's really hard to not eat more than you should be eating too. And yeah, I just didn't personally feel good on it. And like doing genetic testing and figuring out that I'm good with like a moderate carbohydrate, moderate fat dietary plan, and then also dialing in a little bit more with something that was targeting PCOS, because that was something that I also have struggled with, but actually feel like PCOS? I'm overcoming it. Yeah. So I did like the Renaissance periodization diet plan for PCOS, which is totally different than their app. They literally say like, if you have PCOS, don't use our app. I like tinkered with it because Dwight was tinkering with it, and I was like, oh, I'm going to try it. It's not good. So eating carbohydrates, like ramping it up toward the workout, ramping it down after the workout, whatever time of day that is, and then the different types of carbs that they allow. And that worked really well for me as well.
Did you identify which form it was?
Of PCOS? No. I don't know what that means.
So you have your adrenal, you have your insulin, you have your testosterone, and I'm having a brain fart.
It's not testosterone because I've done testing for that. I think it's adrenal. I have had like low DHEA on testing, and it definitely, no, I think I ended up just doing that through Albert, like AHS testing. And it definitely is like a non-issue if I am managing my stress and if I am eating appropriately, not drinking a ton around ovulation and like pushing excess estrogen with drinking, because one drink can increase your estrogen a lot, guys. And yeah, like it hasn't been an issue in months.
That's good.
Months.
That's good.
Yeah.
That's something that I worked with a lot, was PCOS.
Cool.
Yeah. So that's why I had to get like what I run. I did for the longest time was Dutch tests.
Yeah.
But then once I got more well-versed in GI maps and everything, like that's my go-to now because we know your hormones are going to be off if there is an overgrowth, intestinal markers, virus, whichever.
Yeah.
So we always go straight, but I'll use Dutch testing either A, with clients on hormone replacement therapy to make sure that
bioidenticals.
Yeah, to make sure that they're detoxing properly. So whether they're sending 16-hydroxy, 4-hydroxy, 2-hydroxy. But with PCOS, I'll do it to try to identify like, okay, yeah, are you high DHA, low DHA? Are you high androsterone? Are you etocanolone, the 5-alpha preference? So like you can see where it's going. So you have like, so for example, especially with HRT, because a lot of research is indicating SARMs are probably pretty good for women. But the thing is that they're,
SARM?
Yeah, so selective androgen response modulators. Okay. So the issue is though, which once again could come down to a gut issue, but if you are beta preference, you're going to push more to etocanolone, that androgen, which is going to rev up the immune system more. So this is where I've seen when you give them SARMs, they become watery and bloated. It's because they're favoring beta preference. So rather than pushing it to androsterone, which is going to improve your metabolic capacity, muscle building, fat burning, what everybody wants to hear, you're pushing it to etocanolone.
Cool.
Which is more towards immune, is when you see that. And
immune support.
In optimal levels, but then too far, once again, overactivity of the immune system. So then this is where you see them getting really watery and puffy and everything and not getting the benefits of the SARMs. Now, is it the SARM? Well, it's most likely a gut issue causing you to be beta preference.
Right.
And then that way they're feeding into the wrong pathway that we don't want.
Right.
Right. So that's where
it's all about striking a balance.
Yeah. So that's where I'll run like a Dutch test. But now like women will come to me with hormonal issues and they'll be like, well, I want a Dutch test. I was like, you don't need a Dutch test.
Yeah.
Like we know your hormones are going to be off. I don't need a Dutch test. I can physically see it, not only through your HAQ and everything you filled out, but I'm just looking at your stomach. I'm looking at your arms. Like I can tell there's a hormonal issue. Plus what woman doesn't have low progesterone, right? Yeah. So I just go straight to GI map now.
Yeah.
I go straight.
You've been on birth control before, your liver doesn't function, you have
your thyroid shot.
Yeah.
So
it's like, obviously, like we've said, like you can do genetic testing and figure out the nuances of each patient because we still tailor to the patient.
Yeah.
Right. But there is just kind of like an epidemic of these issues that like, generally speaking, we know what they are. Mm-hmm. And then we can use our testing and our knowledge to kind of get you there a little bit more efficiently.
Yeah. I think also too, testing works great because you can sit here and you can say, okay, like I'm sure there's lots you could probably pick out from my behavior that you're like, oh yeah, he's got this, whatever, right? Which I'm going to question you after. But but sometimes
I'm not judging you.
If you put it on a piece of paper for me to see, I might be a lot more receptive to what you have to say.
Yeah.
I experience that a lot.
Yeah.
Because the gut is such a complex topic. So try to explain that to the general population is quite difficult.
Yeah.
So when you get a piece of paper that's red, they're like, oh shit.
I messed up. I get that all the time with my testing too. Like I will do a history and a neurological/physical exam in their first appointment. And I'm just spouting off like neurological words to my administrative assistant who's scribing for me. And at the end of it, they're like, well, what does it mean? And I'm like, like I give them kind of the rundown of like this system and this system and this system are working. And when your arm went weak, when I put your head here, that means that your vestibular system isn't sending signals to your spine. And they're like, oh, okay. But it's just information overload. And they're tired from the neuro exam. So then the next appointment, they come in and we do 3 major tests where we're looking at their balance and we're looking at their eye movements and we're looking at how well their vestibular system is integrating with their eyes and how well they can keep their eyes stable while they're in motion. That spits out graphs. That spits out videos. That shows red versus green versus like wiggles versus like eyes doing funky things. And they're like, oh, I messed up.
Yeah.
And then they get panicked. And then I have to say, whatever we've seen, there's an exercise for that.
Exactly. It's totally manageable.
Yeah, it's manageable. Totally. That's what I do all day, every day. And then they're like, oh, okay.
Yeah.
So they can go home and like, you can have access to your graphs. You can have access to the pictures that came along with them. And you can see healthy balance, severely reduced balance. And those are your outcome markers that we use throughout your intensive. So we're going to run all 3 of those tests again on Wednesday and again on Friday, because we make change that quickly. If I stimulate this pathway 10 times, I'm going to create change.
Yeah.
And I want to make sure that it's change in the right direction. And I want to make sure that I haven't created an asymmetry when I've been pushing this pathway a lot. And I want to make sure that I haven't fixed something which allows something else to come forward. Like, oh, that eye wasn't doing that before. Now that I've fixed this, it's causing another problem.
Yeah. Okay.
And your nervous system is compensating. So we have to do those reevaluations a couple times a week just to make sure that we're staying on track.
Okay.
But patients appreciate that. They appreciate being able to see what is so messed up. It validates their experience so much too. When you explain, it takes your eyes 5 little movements to get from here to here as opposed to 1. If that target that you've been looking for is already gone, you're going to feel a couple steps behind your world. That's going to drive your anxiety. That's going to drive increased tension in the muscles at the base of your skull, because every time your eyes move, you get a contraction at the base of your skull to move your head. So you can start to explain these weird things that the patient has been living with that nobody else has been able to describe. And you put them at ease because you actually understand what is going on and you have a solution for it.
Yeah.
That's huge.
Yeah.
And we don't realize how much those little things eat away at us.
Mm-hmm.
So if you, your brain's number one job is to prevent you from falling down. Because if you fall down, you could concuss yourself and die.
Yeah.
So the 2 constant stimuli that it has on it are movement and gravity.
Mm-hmm.
And that's what we develop, right? We develop the capacity to lift our head up against gravity with tummy time, or keep our head up when we're upright, laying on mum. Moving our head side to side, moving our body, that's all movement and gravity. So if you develop those pathways and then all of a sudden your ability to tolerate gravity is impaired because you have dysautonomia, or your autonomic nervous system is no longer able to get blood up to your brain when you make shifts against gravity, that's huge.
Mm-hmm.
If you can't tolerate movement, whether it's watching things move around you or moving your own head, that is where your brain is going to start putting its resources, making sure that you don't fall down during those times when you're not understanding where you are relative to your environment.
Okay.
That means that your ability to communicate decreases, your ability to modulate your mood, modulate your behavior, modulate your emotions down.
Mm-hmm.
You become like a child.
Yeah.
And then also you become scared of leaving your house.
Mm-hmm.
So going back to our previous conversation and how does that knowledge shape my world now? I can tell when people have anxiety when I meet them. I can tell when people feel uncomfortable. I can tell that a conversation with this person is only going to last 5 minutes and then their attention is going to fly off and then it's not worth me talking to them anymore, and they need space to go and decompress.
Mm-hmm.
So,
which do you find is most people?
These days.
Yeah.
Yeah. I also find that a lot of people are just seeking connection.
Fair.
So it goes both ways. But I get mad at myself for using technology. I get mad at myself for wasting time on TV. I get mad at myself for doing things that basically superficially distract you
mm-hmm.
from actually living your life.
Mm-hmm.
And meeting somebody organically was super important to me, because I feel that's then you want to experience life with that person. You don't just want to sit down and watch TV every single night until you're dumb.
How'd you meet Dwight?
We met at a mutual friend's birthday party in Chicago.
Okay, yeah. I was going to say, hold on. I'll cut it out if I have to, because I asked him, right?
Yeah.
And he said he can't do it. He can't do the podcast because he said he can't legally work.
Oh.
Yeah, so because then he said they messed up his immigration thing or something.
We've been trying to get him permanent residency here in Canada. So
he's American then?
He's American.
Okay, yeah.
Yeah. And I was going to a chiropractic school with one of his friends from Chicago. She came out to Portland.
Okay.
And then she wanted to have her birthday party, her 30th birthday in Chicago, and invite friends from all phases of her life out to the party. So he got invited And then I got invited from Portland and we met there.
Okay. And what year was this?
2018 or 2019? 2019.
So when did you come out to Calgary again? Sorry?
We came to Calgary 2021.
2021. Okay.
Yeah.
So it hasn't been that long then. No. Okay. And like, how soon coming back to Calgary did you start the practice?
We came back. I was here December 2020. And I started the practice April 2021.
Okay.
And like not in the practice where I am now. I was at a integrative medicine practice as a functional neurology chiropractor there. They had like a huge chronic pain patient population. And they had other chiros, they had medical doctors. The main guy is like an MD who does pain management. So he does lidocaine injections, Botox. They had naturopaths. So it was like a really super awesome place for me to land because I didn't know anything about practicing medicine in Alberta. So I learned a ton. He fed me some patients. I had other colleagues in town who were super stoked that I was here because they had learned functional neurology like 15 years ago and never really took the plunge to just fully do that in practice, but they see some neuro cases. So they started sending me patients right away and my practice just kind of like blossomed so much. And like I said, I had an intensive a week since I started.
Yeah. Okay.
And that grew and grew for about 1.5 years. And then I was like, you know what? I want to go out on my own and do this in my own space. And the energy of the place that I was at just didn't feel right. I felt very sterile and hospital-like. And so yeah, now I got to design basically my dream space.
I was gonna say, so that's what I was watching this morning. I want to ask you about that. The attention to detail, even like the words, like the colors you use because it's non-stimulating and stuff. Like how much went into all that?
Tons.
Yeah.
Yeah. I mean, it helps that I got to experience my former employer in Portland. Like he did a build out, right? So we moved offices and his office has won like architectural awards, but like green is such a common color. So I knew I wanted to integrate that, but I still wanted to kind of keep with my brand because I did a whole like branding at the very beginning of this process back in.
And what are the colors?
February or March. I have 8 colors in my brand actually, but like the green and pink is a combination in there. Green and pink, orange and blue, turquoise and yellow, and red and like lavender. So I wanted to keep with the brand colors. I also used Falk Built, which is a like building system. So my walls that weren't already there went up in 1.5 weeks. So the build out process took approximately 4 to 6 weeks total.
Oh, wow.
Like it was super quick.
Yeah.
And so I was kind of limited to like their colors as well because they have their skins that they put over this like compostable material basically. So I picked colors from there that were super calming. I wanted it to be still like fun, but not overstimulating. So I will add a little bit more decor, but it's supposed to be like, you know, soft lighting, not a ton of artwork on the wall that's visually complex to walk by. I have like little sound machines in my ceiling so that noise doesn't carry room to room. I have
sound machines?
Yeah. I can't remember what the system is called off the top of my head, but it's basically like sound masking.
Okay.
So they use like little white noise machines and they put them basically in the center of each room, and then the sound will like cancel and create like a sound barrier. So if I'm in a room without that, the sound can go up into the ceiling and travel via those like panels that are hollow up above it. And you could hear conversations from like one room in the front to a room in the back. And like for patient privacy, I didn't want that. And for acoustics. So I used this sound masking system and it's done a really great job.
I wonder about for something like this.
Yeah.
Huh. I never heard of that. That's interesting.
I thought it was going to be kind of noisy, but it just kind of sounds like HVAC. It's just like
okay, yep.
In the background.
Okay. You should figure out the name of that when you can.
Yeah. It's in my emails.
Yeah, I like that idea. Yeah. So when you walk into your clinic, what about it is just like, yeah, like what parts? Is there multiple parts or is there one big thing? Like whether it's the equipment, colors, whichever it may be. What's something that every day you walk in there, you're like, I love this place?
The colors for sure. I need more plants. Plants would make it even like more. And the dim lighting. I keep the energy in there really clean.
So what do you mean by
Myself. Like, I don't know if you believe in burning sage and all that stuff, but like clearing bad energies. I've done, like I said, a really, I think, great job at, I don't know if you believe in like manifestation, but like being really clear about what kind of clients you want coming into your practice.
Under my doormat.
Yeah. So you want the good people coming in, the people who are interested, the people who are excited. Like I said, skepticism is normal because nobody else is really doing what we are doing, at least in their worlds. Yeah, just continuing to be really clear about that, making sure that I have people in there who are like kind, compassionate humans as well to support my patients if they're not feeling well, because people come in and they feel like garbage. They're terrified, they're anxious, they're angry, they're all sorts of things. So making sure that the people in there are also lovely humans, that makes me happy to come into a clinic space with that. And then, yeah, the equipment excites me for sure. I love my little restful red light room with the diffuser and the little baby plants in there and the soft sheepskin table cover underneath the sheet. And it's just turning into a place where I love showing up to work.
That's amazing. Not many people can say that.
No, I agree. And like it was, we've all probably worked in toxic environments. So even if the place is stunning, maybe you're overworked and underpaid, or your employer doesn't treat you fairly or kindly. And I'm not saying that was my experience at in Portland, but we've all been in those kinds of situations where it's not fun to show up to work for whatever reason. And sometimes, like we said, the relationships are what make it toxic, even if the space is beautiful.
Yeah.
So I think that's definitely something that my patients have perceived. Like they came from the last clinic that I was at, where it was like white and hostile, and practitioners were like barging in on their sessions because they wanted me to meet their patient. Like there was just like no boundaries. The staff was like talking really loudly and poorly about patients that they had just gotten off the phone with. Like there was just like so many inappropriate things taking place there that now when patients come into my space, they're like I feel taken care of, I feel respected, I feel appreciated, I feel calm. Like just sitting in the chairs in the front waiting room, everybody remarks on how comfy they are, and they are super comfy, and I didn't even get to sit in them. Like how amazing was that?
That's funny.
So yeah, just like making it a really inviting space for not only my patients, but making it an inviting space for me.
Yeah. You know what really should be taking notes from you? Cancer places.
Oh.
So I worked with a man, I can't remember what year, we were featured on the news actually, how to save his life from terminal prostate cancer.
Wow.
They gave him 8 months to live. He's going on like 6 or 7 years now, I think.
Holy cow.
So, but I would go with him to the oncologist visits where he got the Lupron shot, which I think is one of the worst ways to treat prostate cancer, but whatever. You go there though, and so I would have like mini interviews with the other patients there who were suffering from cancer. And I know together, Alan was his name, we made a great team.
Yep.
But that guy laughed at fucking everything. And I know that's what kept him going.
Yeah.
Because you go meet these other people, what do their minds automatically do when you're told you have cancer? You're like, it's over.
Yeah.
It's over. My life is done. I'm going to die. And all that, like, you want to get really nerdy, that pessimist, like methylation and neurological issues and all that
and the
kind
cells
of stuff.
of your body believe that.
Your immune system, that's exactly it. And your cells are like, oh, okay, well, let's die then.
We're
right?
down.
Yeah.
Shut her down.
And so like you go there and like you said, hospital environment and everything. Like I wonder what it'd be like if more places like that were like exactly how you just explained your clinic. Like it would be phenomenal. But just because my brain's going a million miles an hour right now. Did you know that the research is starting to show that most cancer patients that go through chemotherapy, when they die, it's not actually from cancer per se, it's candida.
Really?
because the chemotherapy is actually creating an optimal environment for Candida to thrive. Not to mention, you see how much Candida is in office equipment or hospital equipment.
Oh my God.
Yeah. So that's what the research is starting to show. So that's why they're trying to like get away from chemotherapy and find other modalities of targeting the cancer, because they're starting to see what it's doing to like bacteria and everything. And you think, okay, like radiation should kill off that bacteria. But once again, you got biofilms, you got all that stuff. So you may kill off the surface, we'll say.
Yeah.
But you've now created this very, very vulnerable environment, which is a perfect opportunity. It's like the low stomach acid. That's why it's called opportunistic overgrowth, because it took the opportunity of a more base environment to grow.
And like, what if it's in your sinuses? What if it's in areas that like, it's like really deeply buried in there, and then that's affecting your brain?
Yep.
Like, I've definitely seen that in patients. Yeah. It definitely has also made, I think, well, part of it is like me as a doctor and just trying, like I try to bring a lot of positive energy, because my patients do feel like they're dying most of the time. And so that really helps shift them into like a more comfortable place during the history when we're getting to know one another. But also if you can do little things like reduce how much light there's in the room because they're light sensitive, or put a calming color in the room where they're going to be sitting without much visual stimulus, then they're immediately going to be able to like focus on you and the conversation. Honestly, if I put those pictures behind me, I would probably have patients cry.
You know why they're there? The last people before me had some TV mount. It wasn't being held on by nails. So I pulled it off, ripped all the paint, everything. So they're actually just hiding the damage on the wall is all they're doing.
Well, the stripes are a little bit complex.
Is that, yeah, okay.
So if I, like, that would be a really telltale sign for me.
What about that one? That's the cancer guy. He painted that for me.
Really?
Yep, Alan.
Oh, that's so cool.
Yeah.
Yeah, the lines and the marking, like if my patients are dizzy, it would probably trigger them. So like in all of my exam rooms, I just don't have art on the wall.
Just scanning the room, looking for I'm a man, okay? I'm not a very good decorator.
No shade. No shade is being thrown. Just pointing out an example of like that, like people don't think about that.
Fair. Yeah. Never would have thought about it.
Right, exactly. So that's just something that like patients don't necessarily appreciate until it's not there.
Fair. I was actually going to say this earlier to some of the things you were saying, is everybody thinks they're Dr. Phil now. Everybody thinks that, like, if you came over here and you said, oh man, like, you know, the other day Dwight and I got into a fight, and somebody's going to like be like, oh, well, blah, 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 right? Dr. Phil.
Yeah.
And I'm like,
break that down.
First of all, maybe I just wanted to say something. Maybe I just wanted to vent, right? Second of all, you don't know the situation, right?
Decided.
And third, you're not a fucking therapist, psychologist. What you do, just please stop.
Yeah.
Please stop.
I appreciate the conversation around like developing boundaries and like moving away from codependency and like creating a healthy relationship where you and your partner are like developing yourselves while learning how to support one another's needs. Like that is healthy, right? And that being part of the rhetoric or part of the conversation on social media is huge. Doesn't mean you get to sit down and tell everybody about how to approach their mother-in-law. Yeah.
And like you don't know their past traumas.
No.
You know definitely how much that's going to impact every facet of their being.
Yes.
Right? And so that was probably, because I had, do you know Noah and Addie? Yeah. We held their podcast here, but I was a guest on their podcast.
Oh, cool.
And they asked me like, what about a woman icks you or whatever? And
what about a woman icks you, Curtis?
Well, they thought it was probably going to be some typical response, but it was more on the neurological side of things, where it's just like, okay, I get it. Dating apps, you have spoken with and potentially hung out with hundreds of men.
Yeah.
Right? But we go back to talking about manifestation. We think of manifestation in terms of like positive and like growing and everything. But what about manifestation in the negative realm?
Yeah.
If you're looking for something bad, you're going to find it.
Yeah.
Whether you manifest it or whether you just dug deep enough. And so that's where I think another complication lies with more than just dating, whether it's working with a practitioner, with a doctor,
Yeah.
right? Like you talk about, you've experienced these people who have been through many other doctors and practitioners, and they come to you with a very sour taste in their mouth,
Yeah.
right? They're going to try to find something in you to validate that shitty feeling about people in your profession.
Yeah. I would also say people are very quick to latch onto a morsel of hope.
Yeah, there is that too.
Actually. And the second you give them something that's not no, they're interested. Because I think people inherently do want to get better. They may not even have the skills to live a life as a healthier human. So maybe that kind of scares them, but they don't want to be in their pattern of sickness.
What's your view on, I've spoken about this with a few people before. Talk about, we'll just say like depression, for example.
Yeah.
Or we'll say any like health complication. Sometimes people don't want to heal because then they lose their identity.
Mm-hmm.
Like I've had a client say to me that she wants to go get diagnosed with ADD so she can have an excuse for why she acts the way she does. And to me, that you've lost the battle right there.
I agree.
Now that's your identity. Now that's your purpose. And you've been labeled. So now let's go on Vyvanse, Ritalin, Dexedrine, Adderall, whichever, rather than going to someone such as you or myself.
That's your out. It's your scapegoat.
Yeah.
And I do think, like, we kind of talked about people, like, I experience this more in, like, the older generations where they show up to me and they have super complex histories. And, like, honestly, by the time you're 70 to 80 years, God, even 50, but, like, by the time you're 75, you have lived a lot of life and you have, like, oftentimes more comorbidities. You have more disease processes that have been taking place or that are at the point now where you actually have a diagnosis, right? Those dysfunctions, your kidney dysfunction, your liver dysfunction, your gut dysfunction, your neurotoxins, your mycotoxins, like those have all been there for way longer. So those are the people too that come in and they're like, well, Sally got to take a pill. Why can't I take a pill?
Yeah, okay.
Like,
yeah.
Because we're not symptom masking anymore. Like you have been taking pills. You are on 7 different pills and you hate taking your pills and you hate the side effects of your pills. Unfortunately, we are done symptom masking here. We're now dealing with side effects and neurological consequences of, who knows, like the organ issues and the metabolic issues, the side effects of your drugs, the drugs themselves. Like you're well beyond needing just one pill.
Mm-hmm.
But for the younger generations who maybe haven't dug the hole deep enough in terms of like disease processes are still like kind of hoping for the pill.
Yeah.
And it does take a lot of work. And like, honestly, I don't love social media for how unsocial it has made us. And we turn to that for enjoyment. We turn to that for entertainment. We turn to that for pleasure. We turn to that for comparison. We turn to that for answers. We turn to that for motivation. You had a really great post about how unmotivating it is to be on your phone,
Mm-hmm.
to be on social media, and how like you actually don't get motivation from scrolling. And like so many times people post things like, stop scrolling, get off your phone and go do something, like, and stop complaining about how like hard it is to have like so few hours in a day when you're wasting your time on your freaking phone.
Yeah.
When like if your biggest motivation in life is to like be with a partner, well, get out there and go find them.
Mm-hmm.
Expose yourself to new experiences that are outside of the parameters of this little device.
Yeah.
And yeah.
Well, it's not make yourself uncomfortable, right?
Yeah.
Like we all want to be comfortable. We all get very complacent,
Yes.
whether it's a health issue, whether it's a being at home, being on your phone, whichever.
Yeah.
It's just easier.
Yeah. And honestly, like I don't want the patients who want that in my practice.
Mm-hmm. Yep.
And I make it very clear at the beginning, like, because patients often come in and they want the diagnosis or they want to know that there's something other than Vyvanse or Adderall or whatever medication that they the doctor is prescribing them and they have a history of multiple concussions. Like I had this 20-something-year-old kid come in and he, like not a kid, young adult, he wanted something that wasn't a medication as an answer, but he doesn't live in town. So we're going to have to try and...
Wanted a medication? Didn't want. Okay, yeah.
But he was having attentional issues and he's now like in engineering school and he's on screens all day and he's in classes for like long periods of time. And he's like, I used to be top of my class and now I have like no attention span and I have no memory. And this is like really concerning to me. And he's got tons of life ahead of him and he's a super motivated individual. And like we did testing and he's literally like falling asleep through the tests. He had that little endurance in some of these eye movement pathways. And so like, of course, that's going to impact how much attention you can have, how much endurance you can have in a 12-hour day, how much time you can spend looking at something on computers as it's in motion and like moving. So like perfect example of somebody who will respond super well to neuro rehab, however, and like be able to stay off medication, but like he's super driven to make this happen and he's going to have to remain driven because he doesn't live in town. So he's going to come one day, I'm going to teach him his exercises and we're going to have to do like a follow-up in a month. And I'm going to expect that he does his exercises 3 times a day. And like, he needs to know that before we get going with this process. Cause he's like, okay, well now what?
Okay.
What's the magic pill? And I'm like, still not a magic pill.
Yeah.
It's going to take work and you have to be motivated to get out of this. And he is a motivated individual. He's like terrified. He's like, when they do an autopsy on me, they're going to find out that I have, oh my God, I'm blanking on the acronym. Encephalopathy.
Something that none of us probably know anyways.
No, CTE.
Oh, yeah, CTE, yeah.
And I was like, you're young. There's tons that we can do for this. Like, you're going to be okay. But you do have to be motivated and you have to keep that motivation up and you have to be dedicated.
So what are some like expectations you have of your clients?
Yeah. In the beginning, especially if they're going to do the intensive, I don't have that much expectation in terms of like what they have to do, except they have to sleep. They have to eat. They have to eat breakfast. They have to eat lunch. You have to eat throughout the day and fuel your body. If I notice that like when you eat gluten for lunch, you become extremely fatigued in the afternoon, we're probably going to have that discussion pretty early on in the week. And we're going to start trying different things, which it's really great that I actually work 2 blocks away from a grocery store.
Which one?
Urban Fare.
Okay, yeah.
So they have the option to try something different there, or there's really amazing gluten-free options and vegan, vegetarian options so that they can get like plant-based whole foods that taste delicious to support them. KB & Co. is somebody who I get, like my patients get a little discount there. Seed and Salt isn't too far. Heaven.
Seed and Salt, I think I've ate there before.
So good.
Yeah, I think if I remember, it's like bowls and everything.
Bowls,
yeah.
Salads, soups, yeah.
That is really good.
Heaven is like, I think it's Venezuelan, like street food. It's entirely gluten-free.
What's this one called, sorry?
Heaven.
Heaven?
Heaven. And it's like...
By you too?
Yeah.
It's got all these good ones, right?
Yeah.
You picked a good spot.
I did. I was super excited. But, yeah, those are like the main expectations that I have. And then, of course, being open-minded. And I do send out like an intensive kind of prehab sheet so that patients actually know my expectations. So turning out the light or turning off your devices a couple hours before bedtime, actually using your devices minimally while you're here, and not being on your phone during your resting sessions between our sessions. Oftentimes I don't even want patients like reading or using their eyes much. So I have introduced patients to things like binaural beats. So you can get into like kind of altering brainwave activity there. I also have them using different kind of passive modalities that are altering brainwave activity. So my patients who are kind of like constantly anxious, I'll try to upregulate like alpha brain waves. I have a V-Light device that does that. You can also listen to like alpha binaural beats. And
Which do you prefer?
for alpha, it's going to be 10.
Okay.
For gamma, 40.
Okay.
That's what the V-Light does.
What's theta?
Not as familiar.
Okay.
What do you use?
Yeah. I haven't looked into it.
Yeah, not like there's some really great neurofeedback professionals in the city who are like super into that. And I've definitely seen improvements with patients. Sometimes like when my patients get stuck in like hurdles, like cognitive hurdles after doing my work, they need something like neurofeedback to just kind of rebalance the brain waves and like cortical activity. But yeah, the expectations for my patients involve kind of minimizing stress, minimizing excess use of their eyes, because that's literally one of the keys to my rehab. Reducing, and by stress, oftentimes my patients who come in and they have kids, like they might stay somewhere else in the city, or maybe grandma takes the kids so that they can go home to a quiet environment. They usually like being at the clinic all day because they can have like actual rest between the sessions, and not have to worry about managing other people's needs. So then I also say things like help people manage your needs, right? Like pack a lunch or have somebody make some food for you in advance so you can go home and just pop something in the oven and not have to worry about it. Getting good sleep. I usually have a sleep hygiene handout that I give to patients that has a couple of supplements if they need things to help them like fall asleep or stay asleep. Even if it's just like sleepy time tea and you're taking some passion flower and valerian root in a tea before bed and you've turned off your electronics and you're exhausted from the day of neuro rehab, people usually get really good sleeps. So.
Do you use skull cap?
Pardon me?
Do you use skull cap?
Yeah, sometimes. White willow bark, like from Bach Remedies, like it's a little tincture. Really good for slowing down thoughts right before going into sleep. If you've got racing thoughts, personally, if I'm like wide awake, I take a bunch of passion flower and like a scoop of that magnesium citrate.
Citrate? You want to go bisglycinate?
I know, but like for some reason, the calm magnesium citrate, like that powder stuff, like knock it back like it's pre-workout. Take a bunch of water and like it just knocks me out.
Yeah.
And yeah,
I can't do anything serotonin related because I'm already serotonin dominant.
Yeah.
So have you ever done a Braverman test?
Braverman?
Yeah.
No.
You should look it up.
Cool.
Be on a total, like you would understand, be on a total fresh mind and everything though, but it's actually pretty accurate. It's a series of questions for determining your neurotransmitter status.
Cool. Yeah, I wonder if I have a nutritionist friend, and she has like a neurotransmitter questionnaire that she's handed out to like shared patients, and I don't think I've done it personally, but she also does there's another assessment that she would do, and like based on patient's answer she could determine like deficiencies in the body, like micronutrient deficiencies, which is super cool.
I have one for organs.
Oh, really? It's amazing. Like if you just know the questions to ask, you can oftentimes save patients thousands of dollars on tests. Like if I had just done the gut thriving 5 questionnaire, I could have got the same general answer of SIBO as that stool test got me.
So the only reason, like, there is a lot that you could correlate with, but so a good example is, like, I'm on a heavy kick of acromantia right now because of, like, everybody's all obsessed with Ozempic and GLP-1 and everything, and, like, not understanding that if you take Ozempic, you're kind of pulling from an empty barrel if you have undetectable levels of acromantia. But because acromantia is so heavily involved with immune homeostasis, you can actually see high levels of acromantia, but will give off the same symptoms as low levels. It's just one example. So then you also can have, so I have a client in Florida, I think Santa Rosa or something. He had all the same symptoms as me, all the same symptoms. So you would automatically figure, okay, SIBO, some immune overgrowth, mycotoxin exposure. So let's target that. You run a GI map. He had no overgrowth, but no commensal flora at all. Everything was on the low end of the commensal floor. But he had the exact same symptoms as me. And so that is where I'll get into the realm, because I've done it where you majority, I say like 80-20. So 80% you could use a questionnaire.
Yep.
But I work with that 20% is the problem, right? Yeah. So then that's why we resort to the GI map. Because also, you said it yourself, testing can make you just that much more efficient.
Yeah.
But it is amazing, yes, asking the right questions. But here's what I always say to that for other individuals, upcoming coaches, practitioners, whatever. You have to know what to do with those questions.
Yeah. Oh, 1,000%.
Because I mentor coaches. They're like, well, what questions do you ask? And I was like, I could tell you, but then you got to learn what to do with those questions.
Yeah. That's like people they'll do a cranial nerve exam. So you learn it in chiropractic school. And it's like, test your sense of smell, look in the eyes, check your eye movements. Okay, so a person to check eye movements, you run your finger side to side, you do like an H in space, look at their eye movements, and you just like practice the exam to get through the tests, right, that you're taking to become a chiropractor. But like, you don't know when to diagnose an eye deficiency problem.
Okay.
So people are like, well, I did a neuro exam, Rachel, but like, I didn't see anything. And I'm like, because you don't know what to look for.
It's like Fitbits. Oh, I track my sleep. What are you going to do with that information? Yeah. What are you going to do? First of all, it's an algorithm.
Yeah.
It's all it is. Second of all, those electronic waves, I don't care what anybody says. I do believe they I do believe they disrupt. Yeah. I'm totally that guy. The only reason I can't shut the Wi-Fi off at night is because my landlord stays up real late. So I have to have the Wi-Fi on. But I think they have room blockers or something like that.
You could just get like a net for over your bed.
Is that, yeah, that's what I'm thinking of. Yeah, something like that. So.
Or there's like things that you can put over your Wi-Fi router.
Would it affect him though?
No.
No?
No, yeah, it's interesting. You can like block the intensity, I think, of the EMFs coming off. It's just like a sack that has like aluminum threads in it, I think.
Really? Okay.
Yeah. Anyways.
I'll look into that.
Sending links.
So, I mean, I feel like it would be obvious, but is it obvious when a patient is not doing their homework, is not, yeah. I feel like it'd be pretty obvious.
Yeah, I think I didn't end up getting to this part, but like at the last clinic that I was working at, like we had kind of our main doctor, Dr. Z, Dr. Zelinsky, and then we had a bunch of like associates or rehab techs that were working underneath him and like running intensives. So the practice would generally run anywhere from like 6 to 8 intensives a week. And for like a long time, he was like the main person managing all of it. And we were all kind of like trained by like different people or kind of held different standards, or we would have follow-up visits at the end of the intensive with maybe not Dr. Z, but with like the associate, or with Dr. Z and not the associate. So patients wouldn't end up having adequate follow-up care on their exercise performance.
Okay.
And so I started having I made sure that patients, first of all, sometimes the rehab protocols that he would design for home would take way too long. Like way too long. Patients aren't going to sit down. Yeah. Patients aren't going to sit down for half an hour, 3 to 5 times a day when they're trying to get back into their life.
Mm-hmm.
And so I would, run it by him, but make sure that the exercise protocol only took him 10 minutes or less.
Okay.
So that it was actually tangible, right? You can take 30 minutes throughout your day to do these exercises to maintain your progress. That can be the first 10 minutes of your lunch break, 10 minutes of an afternoon break, 10 minutes when you get home. Done. Doable.
Yeah.
So that was the first thing that I started implementing. The second thing that I started implementing was making sure that my patients who would come for follow-up visits after their intensives would sit down with me to review their exercises and review their technique, because patients leave with they're overwhelmed. Sometimes there's a ton of information. You shared a ton of information for how to do the exercises, and they don't retain it all.
Mm-hmm.
You can only retain so much. So I would find that they would come in and maybe their symptoms were worse all of a sudden. While they were doing this exercise inappropriately, they had their head turned the other way.
Yeah.
Or they were going this instead of this. Technique totally matters in this world. So I would make sure that I was following up with them to ensure the technique was appropriate. And then we would start to have better like patient outcomes and also better patient compliance.
Mm-hmm.
So I have found that to be like super helpful in my practice here and something that I've continued. Because if you don't follow up with patients, all of that work that you did and all of that investment that they spent, like it goes down the toilet to some extent. They don't go back to zero, but they don't continue to progress.
Yeah.
And I've kind of found the sweet spot. If patients perform their exercises at least 3 times a day, maybe more some days, but 3 times a day consistently, then they continue to improve, although the improvement is like at a slower incline than when they were in with me, because life, etc. If they do it more, they see more improvement more quickly. And if they do less, like twice a day, they tend to just hold the improvement that we made in the clinic.
Okay.
So
they're not regressing, at least.
They're not regressing, but I usually run my diagnostics 4 to 6 weeks after the patient has done their intensive again. And I've seen some patients come in and like they're in the exact same place. They have the exact same level of gaze instability. They have the exact same accuracy of their eye movements. They have the exact same asymmetry in their vestibular function than when they left.
Mm-hmm.
So it's kind of interesting to kind of be the only one taking metrics on this stuff and actually being able to give patients solid advice on like how to go home and get better.
Okay. So you made the comment about them not retaining. Here's like I'm curious on your perspective of this. This is something that I experienced in my coaching career with my coaching abilities. It wasn't that I wasn't retaining information. I became reliant on the guy above me. So instead of trying to figure out answers and learn on my own, I just resorted to him for everything, which is a horrible idea because he was a dickhead. But so once I really got away from him, that's when I really began to learn. Do you think that kind of happens with patients as well? Is they're just very reliant on you?
With patients?
Yeah. So they're like, it's not that they're not retaining. They're just like, this is probably not it by any means, but it's almost like that side of the brain shuts off because they know that you're going to be taking them through it again anyways.
There's a couple of ways in which this is applicable. So like at the beginning of the week, patients don't have the capacity to do these exercises on their own. I am doing everything for them, whether it's because they don't have the head awareness, they can't tell when they're tired, like all that kind of stuff. Closer to the end of the week, I start saying like, oh, did you feel that when I feel their neck tighten? Oh, did you feel that when I see their eyes kind of jitter back and forth? And I start trying to educate them on what it feels like to feel fatigue in their body, things that I've been tracking. And they start to be able to have a little bit more awareness because they're less like, where am I? And then by the end of Friday, I've taught them their home exercises. I've made sure that we've repeated them. And I'm giving them the tools to be able to pull them out of whatever symptoms they've had often. So like if a patient, we do testing Friday morning. So sometimes I will still flare up a patient's symptoms. Well, we sit down and I have them do a couple of their exercises. I have them be the ones do it and they feel their neck tension decrease. Hey, you now have a tool to decrease your own neck tension. People love that.
Mm-hmm.
People love to actually feel like they don't need to rely on me. And I love that patients don't need to rely on me. So I try to give as much to my patients to empower them to get out of whatever they are experiencing in the neuro world as possible.
Okay.
Even with supplements, like there's a couple of really great supplements out there to like manage histamine levels.
Pretty easy.
History Set
is that Designs for Health?
Pure encapsulation.
Oh, pure encapsulations.
But
have you ever
only available in the States?
Yeah, same with like Seeking Health. They have the actual DAO enzyme. Yeah, Seeking Health does. It's pricey, but they have the actual DAO enzyme.
Yeah, sometimes like History Set is basically all of the cofactors that you need to break down histamine.
And such.
Quercetin, molybdenum.
Is there molybdenum in there?
Yeah.
Yeah. Okay.
I think we just said the same thing. Yes. So it has like a really good combination because sometimes patients are missing some of those cofactors.
Yep.
So teaching patients what high levels of histamine feel like in their body and when to apply a history set if it's not all the time.
Mm-hmm.
Sometimes it is in the beginning because they're just like so inflamed.
Yeah.
But
that's one another reason why I do like the GI map, because you have like Klebsiella, for example. It's a very histamine producing bacteria in the autoimmune category.
cool.
So as soon as I see that, I'm like, oh yeah, you need some support. But the problem with the histamine support though is it's so expensive.
Well, that's like history set. I sell it for $80 at the clinic.
Yeah.
It's not that bad.
See, to you and I, it's not that bad because we understand the mechanism, we understand the quality, we understand the price per serving. To the average population, that's a lot of money.
Totally.
Because they don't understand.
Yeah. But I think I end up, if you like, that's why I'm so kind of cognizant about finding something that really works for like a lot of people so that people can really like feel that difference. Obviously, if they have an underlying Klebsiella, then throwing history set is probably just like masking the Klebsiella, right? Not necessarily treating it, but I like to give patients supplements when I know there's going to be kind of a good perceptible shift.
Yeah.
Whether it's like in how well they're responding to the neuro rehab or how well they're tolerating smoke outside or like things like that. Beyond that, I'm like, you know what? There's something more going on here and there's somebody better equipped to be able to help you kind of make long-term shifts in a more positive direction towards like fuller health. And sometimes people are so, you know, like the cost of an intensive it's an investment. You're spending 6 hours a day with somebody who has an advanced skill set. So it by the end of that week, sometimes patients are tapped financially for a little while at least. So you do need to kind of just set them up for at least like a month while they're just implementing these exercises at home and building themselves a little bit more bandwidth so they can get further away from the ditch. And then they're able to kind of see a little bit more clearly what needs to happen. It's like, oh, when I eat this, I still get this symptom sometimes. So I'm ready to approach that now.
Yeah, okay.
Yeah.
A lot of times too, it's so hard because I always say like our jobs would be so much easier if people were robots. But then we probably wouldn't have a job. But because like it's funny, that complacency factor. So when you talk about histamine, people are so used to histamine reactions that they have no idea what a histamine reaction is, or let alone what's causing the histamine reaction.
Totally.
Because you get so used to it. It's like, so with my sleep apnea, I stopped breathing 71 times an hour.
Yeah.
My oxygen levels will drop down to 75%. I just thought I was a fat, lazy piece of shit. Like that's all I thought. Like I didn't know that I was dying in my sleep every night kind of idea. And so like you just become so complacent to how you feel. Like I'll get people with like distended guts out to here. They're like, I feel fine. I'm like, yeah, but what's your definition of fine? You know what I mean? Like,
yeah. And I can attest to that. Like you with your sleep apnea, me with my SIBO, like I didn't realize that like a normal level of brain fog is none.
Yeah, right. Yeah.
Or a normal level of bloat was none.
Yeah, like, exactly.
So then this is something I experience with my patients a lot too. Like you get their nervous system working better, you get their overall system working better. Then when they have a noxious stimulus, such as eating dairy, which typically blows them up, they're like, I'm dizzy, my gut's out to here, I have abdominal pain, oh my God, my world is ending and I've gone backwards. And I'm like, yo, give yourself a couple days. Yeah. And sorry.
God, it's mine. I was like, I don't have a doorbell.
Give yourself a couple of days to like chill out. It's just my phone.
It's an alarm?
Yeah. Okay. I just got a pay phone call at 2:30. So I wanted to give myself a little bit of time.
Or up.
Yeah. But, get patients feeling better. And I'm sure you see this all the time too. And then they have like a backslide and they feel the stark contrast of actually feeling well and feeling unwell. They've felt like abdominal pain every single day for 7 years. So to go from having no abdominal pain to like acute abdominal pain, like it's awful.
Yeah.
Like I've never been a headache person. And when I get a headache, I'm like, oh my God, it's the end of the world. And then I have my patients who come in who are bright and chipper and their headache is 6 out of 10 every day. And I'm like, you're my fucking hero.
So obviously, like, as I do the same thing when I meet people, right? So what are some of the things that you could pick out from a neurological perspective in me? Obviously, it might not be the best environment to assess that, but I know someone in your profession sees something, like pointing out the photos, for example. But what about me personally? And don't hold back. I have tough skin.
Well, I mean,
Fuck off, get out of my house.
You've held really great eye contact the entire time. Haven't necessarily noticed like a droopy eyelid on one side or the other. But maybe, yeah. And it's hard because we've got light coming from one side. You've got a head tilt because you're facing me. So it's really kind of tricky right now. And I have been trying. When you smile, you have a little less tone in the left cheek.
In the left?
I think so.
So now, how much could that be driven by, I have a messed up tooth. So a lot of self-consciousness about it. How much could that be messed up by in terms of neurological aspect? Or would that still be something...
How do you mean, like, which, like, what are you
so
talking about?
When it first happened, I used to, like, I'd be like, oh, right.
Oh, yeah.
You cover your mouth. I just don't really care anymore.
Yeah.
But so could it be a mechanism of me trying to still subconsciously hide my tooth so I don't fully vibrantly smile? Or is there something fucked up in my brain? Because I feel, now that you say it, I feel it. I feel this cheek now. That's all I'm going to focus on.
I don't know. Usually, I don't know. It could very well just be like a subconscious mechanism. But like if I asked you to extend both sides as much as you can, you still have less tone on that left side. And you still don't elevate that left eyebrow as much. So you're a little bit like...
I feel it. So what is that? What is the symptoms of that?
Well, it can be a little bit of decreased function on the left, like pons, middle part of your brainstem. And that's all I can tell you right now.
So what you're saying is I need to come see you.
Well, check things out.
I do want to. There's one more thing I was going to say to that. Because like the eye, for example, because like you'll sit there and you'll be talking to a woman or something and she'll be like, oh, send me a selfie or something. And you'll be like, just like, oh
wow.
my God.
No, like my sister points it out in me all the time because I had that concussion when I was so little. Yeah. And I, like when I smile, I'm like, and so she would have it. She would like, we'd take pictures and we'd be looking at the pictures and she'd turn around and she'd be like, what is with that? Like, just lift it up. And so I started trying to smile. I just look like a total dork, but it's...
You know how women are sometimes, like, I'm sure men do it to get rid of the chin when they take photos. So what I do when I go to take a selfie, I'm like, get it ready. And then I kind of calm them down.
And like,
I notice
posture can also create lower.
So so quickly on that, where's your tongue posture? Where do you prefer it?
Slightly elevated in my palate.
Yeah, so pressing up against the teeth kind of idea.
Yeah.
Yeah, that's what I try to maintain.
Yeah.
That way it promotes nasal breathing as well.
You should. So you still have sleep apnea?
No, I got rid of it. They told me I never would. That's why I'm so passionate about what I do.
Good job.
Yeah. So because they said it was a neurological. I think it was from SIBO for sure. Obviously inflammation. I was bigger at the time too.
Which is going to promote inflammation to like up the vagus nerve to your brainstem and actually impair the palatoglossus muscle.
Okay.
Which is again innervated by the vagus nerve. So something that people can do. I follow Stephen Lin. He's really awesome. He's like a functional dentist. And he talks about tongue clicking. So like pressing your tongue to the roof of your mouth, like sealing it all the way in the back and clicking.
That's hard. Like that?
Yeah, except for...
I don't think I'm doing it right. I can't.
Yeah, you want to like move the back of your like soft palate.
Huh. That's going to take a lot of practice.
Maybe it'll enhance the fact that you don't have sleep apnea, and it's a way to like activate your vagus nerve.
Well, I was also a very big time mouth breather.
Yep.
That was a huge epiphany, discovering the importance of nasal breathing.
Yes.
I still do it. So I actually
Do you tape your mouth?
What, sorry? No, so I actually do the opposite because I'm kind of wishy-washy about taping mouth because sometimes I feel like you might need that air. So I'm just going to tell you. So I haven't been with a woman for a long time for several reasons, but one of them is I wear that jock strap thing over my head.
Oh.
So I keep my jaw up or whatever. And then I tape my nostril every night I go to bed.
Open it up.
Yeah. So
And that's why you haven't been with a woman in a while?
Nah, I just, I know if I'm not going to wear that when I'm with a woman. So
You're like, I really need to prioritize sleep.
I need sleep. Yeah.
I am abstinent.
Right? So, but that for me, because the tape, I felt I would get chest tightness for the tape. Now,
Claustrophobic.
with that being said too, though, that was when bacteria was higher. So it might be an entirely different situation now for taping my mouth, but I still just use that jock strap thing.
Can you use it with facial hair? The taping?
Yeah, I did a lot. Another thing too is if I wake up in the middle of the night, because I still obviously there might still be some parasite, and so I have to do like a full moon protocol and be a colonic and everything. But I wake up and I'll take like theanine and niacinamide or something, and maybe some more melatonin depending what time it is, so I pass right out. So then I would have to rip the tape off my mouth, take everything, try to tape it all back up, and that whole process is probably going to wake me up a little bit. So that's another reason why I stopped taping my mouth.
Not great.
So
do you have to wake up in the middle of the night to do a colonic?
No, I just meant
the whole moon protocol. I was like, are we up with the moon?
No, because it's so funny because I actually thought in terms of parasites, the full moon protocol was bullshit. It's not. It's a legit thing. Yep, it's a legit thing.
I had a patient who for some reason, she didn't want to go down this rabbit hole, but she used to be a whitewater rafting instructor, and then she got concussions, and then she would have her symptoms flare every time it was a full moon.
Mm-hmm.
And I was like, dude, you've got blastocysts hominis or something.
Well, it's because you're an asparagus.
Yeah, so she continued to suffer and never ended up. I like mentioned that to my boss at the time because it came up. I was doing some biocidin work when I was educating with that company, and they talked about that. I was like, holy shit, this is Rochelle.
Yeah, I use Cellcore now. Cellcore's got very good products for the parasite protocol.
Nice.
They have very good products for that. I was also going to say, a lot of people don't know too, the moon, this is for all you astrology people, it's melatonin gets significantly compromised on a full moon.
And melatonin is a huge brain detoxifier.
I take a lot of melatonin.
Yeah.
A lot of it. If I have people with excessive dopamine, they'll take melatonin throughout the entire day. They feel so much better.
Wow, cool.
Yeah. That niacinamide, they feel so much better. So
sweet.
So how about you tell everybody, give us your location, your Instagram, your website, how to get a hold of you, all that information. Hit me with it.
I am currently in High Street House building down on 17th Ave. So between the 8th and 9th blocks on 17th Ave, nice and central, right by Best Buy and StrucTube. You can find my clinic on Instagram at Anew Chiro Clinic. You can find me at www.anewchiroclinic.com. And yeah, if you're interested in red light therapy, you can do that on your own. You don't actually have to become a patient of the clinic. You can, we're doing a 10 package price, so $350 for 10 sessions, and you get 20-minute sessions whenever you want. You can schedule it all online. So yeah, if you want to start dabbling in light therapy, that's one way to do it. And come check out my Instagram. That's where all the magic is happening.
Yeah, I'll put everything in the caption so that way people can see it or whatever. But yeah, I'm on topic on that red light. Yeah, everybody, it's amazing.
It's the most amazing non-invasive therapy with literally other than what we've talked about, sometimes upregulating detox pathways, but no serious side effects and only a shit ton of benefits.
Yep.
So for patients who aren't necessarily interested in doing a full neurological workup and intensive therapy, there are other modalities that we have at the clinic to help with recovery. Normatec compression boots are there as well. You can do those on your legs or your hips or your arms, and work on some of that lymphatic movement, but also moving lactic acid out of those muscles that might be a little bit stubborn in the recovery process. And yeah, if you have any questions, you can reach me through the website, the contact forum, or you can hit up the DMs on my Instagram.
Groovy. I feel, first of all, this was the fastest over 3 hours ever. And I think it's one of those situations where my brain is going a million miles an hour, not due to like ADD type stuff, but it's like there's so much you and I could talk about. So I'm definitely going to have you on again.
Cool.
Definitely going to have you on. The first one's always like, not that we were unorganized, but
we went very, very deep, and then we went super up here. So I think we'll get a lot of like really great levels of interest.
Yeah.
Different educational levels as well. And then maybe next time we can be like, oh, like we forgot to talk about this.
100%, right? And then if you want to use those chairs, we'll use those chairs.
This is super comfy. I love having a dog next to me.
Yeah.
I'm not going to complain about this. I think I prefer the couch.
Except all the damn snoring.
Oh, it's just the end of a good sleep.
It's all good. I can edit that anyway. So, but thank you so much for your time. I'm super happy you came on. Like, it's like I said, I love to nerd out about this stuff and learn from you. And just having someone as knowledgeable, intelligent as you is just, it's my life force, right? So
I know it fuels us, and we have to. Thank you so much for inviting me on and for putting yourself out there, even though we had never officially met.
Yeah.
I appreciate that so much, and I was just like, fuck yeah, let's do this.
Right on. Well, thank you so much. Okay.
You're so welcome.
Okay, guys. Take care, everybody.
Bye.